Good afternoon. The Senate Finance Committee is now in session, and we will begin this afternoon with Senate Bill 496, Senator Vital. Senator, take the time that you need to explain your bill. All other respondents will have 2 minutes each. Thank you.
Thank you. Thank you, Madam Chair, Mr. Vice Chair, and members of the Finance Committee. Thank you for hearing Senate Bill 496, Business Regulation, Miscellaneous State Business Licenses Alterations. This is a modernization bill. It's to update the business licenses for the state. Thank you for the opportunity to present 496. This proposal was brought to me by the Maryland Circuit Court Judges Association, Maryland Circuit Court Clerks Association. Although it is a large bill, it's very simple. Senate Bill 496 simply updates and clarifies the Title 17 of the Business Regulation Article to reflect today's technology and practices, some of which that have been outdated for more than 30 years. I have with me two representatives of the Circuit Court Clerks Association who will explain Senate Bill 496 and answer your questions. I do want to give you a heads up. There's possibly two amendments, one on warehouses and one on supermarkets, and we'll see if those amendments come in, but I don't have them at this time. So thank you, and I look forward to a favorable report.
Thank you. All right, we'll go next to Dwayne Lindsay.
Thank you, Chair Kelly, Vice Chair Feldman, and members of the committee for this opportunity to testify in support of Senate Bill 496. For the record, my name is Dawn Lindsay, Clerk of the Circuit Court for Allegheny County. My testimony today is on behalf of the Maryland Circuit Court Clerks Association, which represents the elected clerks of the Circuit Court in Maryland. Our Clerks Association supports Senate Bill 496 because it accomplishes several important updates to business licensing. Specifically, Senate Bill 496 updates wording in Title 17 of the Business Regulation Article to allow for modern technology. For instance, whenever the title refers to the use of paper, that language has been expanded to allow paper or electronic means in order to reflect today's business practices. The proposed changes update definitions in Title 17 to answer commonly asked questions, such as clarifying that the title applies to for-profit businesses and not apply to not-for-profit businesses. The proposed changes clarify that issuance fees collected by the clerk shall be paid into the general fund of the state. The proposed changes update notification requirements between the comptroller and the clerks to reflect current business practices and clarify the language regarding the transfer of licenses from one party to another. The proposed changes clarify that non-resident construction licenses shall be issued in the first county in which that company does business. The proposed changes also clarify when a business needs a peddler's license and when it needs a trader's license. For instance, it clarifies that for a mobile place of business, such as a food truck, if the business is always parked at the same location when doing business, then it should be issued a trader's license. But if it moves around, then it should get a peddler's license. The proposed changes clarify a long-standing question regarding whether a storage warehouse license applies to self-storage units or not. It codifies the long-standing interpretation from the Comptroller's Office that the business itself should be issued a warehouse license, but every individual in the warehouse does not need a license. Our association hopes you'll give a favorable report on Senate Bill 496, and we would like to thank Senator Vital for sponsoring this bill. And now I'll turn it over to my colleague, Scott Pryor.
Thank you. Are there any questions of this witness? Okay, thank you. All right, we'll go next to Scott Boyer.
Thank you, Chair Kelly, Vice Chair Feldman, and members of the committee for this opportunity to testify in support of Senate Bill 496. For the record, my name is Scott Boyer, Clerk of the Circuit Court for Anne Arundel County, and my testimony today is on behalf of the Maryland Circuit Court Clerks Association, which represents the elected clerks of the Circuit Court in Maryland. Our Clerks Association supports SB 496 because it accomplishes several important updates to business licensing. First, in order to reduce bureaucracy and streamline business licensing, it proposes to repeal 4 types of licenses as follows. The first type of license recommended for repeal is Subtitle 4, amusement devices, also known as pinball and console machines. Decades ago, there may have been thousands of pinball machines licensed in the state of Maryland. In 2021, there were only 5 licenses in the entire state. And these 5 licenses brought in a total of $304 to the Maryland Treasury. Repealing this subtitle would reduce bureaucracy and have almost no effect on state revenue. The second type of license recommended for repeal is Subtitle 7, Wholesale Farm Machinery Dealers. There were only 2 licenses issued in 2021 in the state of Maryland, bringing in a total of $254 to the state. If this subtitle is repealed, it will eliminate duplication with the trader's license, which is required of any business that buys and sells goods in the state. The third type of license recommended for repeal is Subtitle 15, Plumbers and Gas Fitters. A total of 324 licenses were issued in '21, which generated $6,206 in licensing revenue for the state. Although this license would have a small effect on state revenue, it is recommended for repeal to eliminate the double regulation of plumbers and gas fitters. Currently, plumbers and gas fitters appear to be the only profession in the state who are required to obtain a professional license as well as a business license. The fourth type of license recommended for repeal is Subtitle 20, Trading Stamp Issuers. Your parents, grandparents may remember companies such as S&H Green Stamps, where grocery stores gave out stamps when you paid for your groceries. The stamps could be collected into a book that could then be traded in for prizes. No trading stamp licenses have been issued in 2021, and there have probably not been any issued in the last 30 years. We checked back as far as our records went, and we could not find any instances where this license had been issued. So we recommend this license for repeal as well. Our association hopes you give a favorable report on SB 496. We would again like to thank Senator Bidle for sponsoring this bill. Thank you for the opportunity to comment, and I'm available if you have any questions.
Are there any questions? Senator Reedy.
Thank you, Madam Chair. I just wanted to commend both of you on your outstanding testimony, and I mean that sincerely, because I was reading this bill, trying to figure out, normally you can read the fiscal note, but the fiscal note in this case isn't as clear, no offense to the fiscal note writer, just you itemized it all very well, so thank you, Senator Bidle. It's a good bill. I appreciate you bringing it forward. It looks like there's a couple people want some amendments to it, but this is part of our job too, is to try to clean up the code and make sure things make sense. And so, thank you, Madam Chair.
Okay, thank you. All right. Now we have Bruce Bariano and Melvin Thompson, both favorable with an amendment. And you have 2 minutes each.
Good afternoon, Madam Chair and members of the Senate Finance Committee. For the record, Bruce Bariano. It's a real pleasure to be here. I'm here on behalf of the Maryland Self-Storage Association. I commend the sponsor of the bill and the purpose of the bill, and I believe in code revision and updating. But very regretfully, what this bill does is it creates a new piece of law. It will require my clients to have a license, a state license, and there is absolutely nothing in the Maryland Code as we sit here today that requires a state license for a self-storage facility. I please ask you to go to page 30 of the bill, and if you please look on lines 16 and 17, for whatever reason, storage warehouses, which are not self-storage facilities. This committee has had a lot of legislation, I've been before you, on self-storage facilities. We are not storage warehouses. But what this does, if you look at line 17, all of a sudden it's saying that a storage warehouse also includes a self-storage warehouse. And therefore, we have to have a license. Now, I've talked to all my clients. We have local licenses, Madam Chair and members of the committee. We, of course, have that. But the only thing in the Maryland Code right now dealing with self-storage facilities is in the commercial law article. I've been before you on that, and that deals with consumer protection and the contracts, et cetera. But what you're doing in this recodification and modernization is you are putting on a business, my clients, a new state license. And I don't know what the comptroller's office is saying. I don't pay attention to the comptroller's office. It's not in the code. So you shouldn't pay attention to the comptroller's office either. Seriously, there's nothing in the law. If you pass this, it will be in the law. And something substantive like that should not be in here. It's not appropriate. It's not necessary. We're licensed locally. And you're creating new law in this. And I would like you to take it out. I submitted an amendment to take out this inclusion of self-storage facilities in the definition of storage warehouses. I'm sure some of you are respectfully familiar with self-storage facilities, and this is not that. And I spoke to Senator Bidel. I'm not trying to injure her bill or anything like that. It just should not be in here. And I asked you to take it out, and I'm happy, and I'll go along and support the bill. No, but seriously, really, I mean,
Are
you
there
know.
any questions of this witness? All right, you've made your point. Thank you.
Thank you very much.
All right, and now we'll hear from Melvin Thompson. And
Thank you very much, Madam Chair, members of the committee. I'm Melvin Thompson, representing the Restaurant Association of Maryland, and we're testifying favorable with amendments on this legislation. And the Restaurant Association of Maryland supports the goal of this bill, which is to update and alter business licenses. And back in 2009, the General Assembly repealed an antiquated soda fountain license at the request of our organization. But we have some concerns in the bill regarding Subtitle 16 about license requirements for restaurants. We believe it's unnecessary, duplicative, and even confusing to require restaurants to have both a restaurant license and a trader's license. Restaurants should not be required to also have a trader's license because our industry does not primarily sell inventory at wholesale or retail in the sense that the trader's license is intended. Restaurants and other eating places are primarily in the business of preparing and serving and selling value-added food service products. And I want to thank Senator Bidel's office for putting us in touch with Mr. Poyer at the Circuit Clerks Association, because we've had conversations with them and explained to them our goal for the amendment. And we're currently working on amendment language that we hope that the Circuit Clerks Association will also support so that we can bring that language to you for your consideration. Thank you very much. We appreciate the time.
Thank you. Are there any questions? All right, if not, then that ends the testimony on this bill. Thank you. We're going next, Senator Bidel. Yes, you can. Senator Bidel Day. Maryland Transit Administration Police Collective Bargaining Supervisors and Sergeants. And we'll ask Nita Hodges and Kevin Moody. All right. Now, you have the time that you need to explain your bill, and your witnesses have 2 minutes each.
Thank you, Madam Chair. For the record, Senator Pam Bidel. This is Senate Bill 475. So, Madam Chair, Mr. Vice Chair, members of the committee, thank you for hearing Senate Bill 475. This is the Maryland Transit Administration Collective Bargaining for Supervisors and Sergeants. Senate Bill 475 adds sergeants and supervisors within the Maryland Transportation Administration Police to the list of employees authorized to collectively bargain with the Maryland Transit Administration. Currently, MTA police supervisors and sergeants have no viable avenue of addressing issues regarding their workplaces, wages, and benefits. MTA supervisors oversee MTA employees who are represented by ATU Local 1300. Local 1300 members receive regular cost of living upgrades and in many cases have either matched or exceeded the wages of their supervisors. Being unable to negotiate wages has led to severe wage compression, which leads to high turnover and low morale. New regulations on law enforcement officers are going to increase sergeant supervisory tasks and responsibilities. MTA supervisors and sergeants are vital to ensuring safe and sanitary public transportation and deserve respect for their work. They should have, like other MTA employees, the right to collectively bargain their wages, benefits, working conditions, and staffing. I respectfully request a favorable report on Senate Bill 475. Thank you, Madam Chair.
Thank you. Are there any questions? Okay, if not, then we'll go to Nita Hodges.
Good morning. Thank you for having me here this morning. My name is Nita Hodges Reinhardt, and I'm an assistant superintendent at MTA, where I've been employed for 12 years. I started as a bus operator and then moved up to field supervision and quickly advanced to assistant superintendent. I'm here to support SB 475 because our agency is dying internally due to unfair labor practices, which has been an ongoing problem within the organization. such problems as my subordinates making higher wages than me. The office staff has access to unlimited sick leave. They have the stability of a regular schedule with holidays and weekends off based on their seniority, whereas Tisha employees have individuals with 20-plus years of service that still is not earning weekends, holidays off, or the salary that the operators are earning. Support of SB 475 would correct this. They have a collective bargaining agreement to govern their relationship with the agency. Frontline management would like the same benefit. Many Tisha employees have been forced to file complaints with outside agencies due to the lack of transparency within the agency. I ask you to please support this bill and give us the fair opportunity to have the benefits that our subordinates have. Thank you.
Thank you. Are there any questions? Okay, in that case, we'll go to Mr. Moody, Kevin Moody.
Yes, ma'am. Good afternoon. Thank you for having me. Sergeant Kevin Moody. I'm a sergeant with Maryland Transit Administration Police. I've been a sergeant since 2019, been with the agency since 2015. Right now, I'm assigned to Northern District Patrol. Again, I just wanted to thank you all and allow me to speak on behalf of my fellow sergeants in support of Senate Bill 475. Some of the issues that we're having, first of all, would be on call, but not being compensated for it. We literally have to modify our lifestyle for an entire week. We're on call from Monday through Sunday, and there's no compensation. Issues with that is also that it's being as though it's nothing written down, there's no policy. Things are just not being implemented. Some supervisors don't get put on call. Some people get 4 or 5 weeks, while others may get 1 or 2. The next issue would be the responsibility. We have to supervise sometimes 14 or more officers when our training states that we should be responsible for no more than 4. Also, with us being responsible for so many officers at once, I think that it's also important to bring the light the ground that we cover. We have 2 districts, northern and southern. So I'm in northern district. We're literally responsible for the entire northern half of the state. Not the city, but the entire state. Next issue would be pay issues, like we've heard already. It's not receiving monies promised. Like we got an email from Governor Hogan stating that we would get some type of bonus. We didn't receive that. Also, some supervisors make less than the officers under their supervision, and then supervisors are also inside of the incorrect step as far as what pay they're supposed to be in. Last thing would be grievances or remedies of issues. We attempted to remedy issues with upper management, but we were informed that we don't even have the right to bring up grievances. Tisha literally states that police sergeants and above do not have the right to grieve. We're exclusively excluded from this policy per COMAR. So please be advised, though, that all other Tisha's members have the right to grieve, but police sergeants and up do not. So as of now, the only way for us to get any issues resolved would be through litigation. I truly believe that these issues could be resolved with a conversation and not a fight in court, not to mention the amount of money that it costs both the sergeants as well as the state of Maryland trying to fight it in court. In closing, I'd like to advise the mission statement of the MTA, which states that we are to provide safe, efficient, and reliable transit across Maryland with world-class customer service. Now, of course, our job as police is to ensure the safety or safe aspect of that mission statement. So in the short term, it's about being able to resolve our issues, but in the long term, it's about keeping the MTA safe and being able to deliver that world-class public service. Thank you.
Okay, Senator Reedy and then Senator Hayes.
Thank you, Madam Chair, and I thank you both for being here and for your service. I'm curious, maybe Senator Bile, I may want to ask you this question. In the bill, I was just looking at MDOT's statement on the bill. That one of the things they point out is that they talk about some of the National Labor Relations Board law, but they say it's not clear in the bill what supervisor means and who that means. Besides, obviously, sergeant is spelled out in the bill. I was looking through the bill, but is that a fair point, or can you?
I actually didn't get to read that letter today.
I don't mean to take you by surprise.
No, that's
yeah.
okay. But, both of these folks talked about supervising subordinates.
Right.
I think that makes them supervisors. They have people that they must supervise.
But, I mean, the secretary is a supervisor too, so I mean, I'm trying to I'd like to figure out what's the cutoff of who gets to do the collective bargaining? That would be the question.
In this bill?
Yeah,
Well,
does it define
it's the sergeants, obviously.
Yeah,
And
yeah.
I guess sergeants and above, right? And supervisors. I mean, if we need to define it better, if you don't feel like it's well-defined, we can certainly have further discussion.
I just didn't know if you'd seen that letter and what your comments were. One other question, if I might, and maybe you all may be able to answer this better, I'm not sure. I know there's other agencies with police departments, correct? So do other agencies have this right or at this level or not right now?
Yes. I'm pretty sure it was I think Bowie State. It's a few other agencies that I know for a fact does.
Is he
Like I said,
signed up?
like I said, though, with us being Tishers, like I said, we're a part of a union, but when we had issues and attempted to grieve it, that's when it's brought up. Well, Tisha states that because you're a state employee and a sergeant
And a
above, you
supervisor
don't-
or a
you
sergeant.
can't do this. But
Okay.
there are other police
I was
agencies,
just- I'm
sir,
curious,
yes,
okay.
that do have the right.
Okay. But, well, I guess what I mean, and Senator, I mean, maybe we can talk about it offline, is there other police agencies that have the right that sergeants and supervisors
Anne Arundel
can?
County sergeants do.
Okay, all right, thank you.
Madam Chair, there's someone here that could answer questions. He's not signed up to speak, but he could answer
Well, I
this
can't
question.
do that now, but if they want to send us back information, we'd love
Okay.
to have it.
Thank you.
Okay, Senator Hayes.
Gotcha. Thank you, Madam Chair. Sorry, can you give us the idea of like the hierarchy in the organization? So it's an officer,
Yes, sir.
what is?
So we have a officer, then you have a corporal. So corporal is like a first line supervisor, but they are still a part of the union. Once you get sergeant, your management. I mean, even your pay change, you go from getting paid once a week to getting paid every 2 weeks. You go on the state every other Wednesday. Then from sergeant, you get lieutenant, captain, major, lieutenant colonel, and then the colonel, which is the chief of police.
Right, so to Senator Reedy's point, I know at least in the Baltimore City Police Department, you start off as an officer, you may be an officer in charge, then you're a sergeant, then you're a lieutenant, then you have a captain and a major.
Yes, sir.
But everything above a lieutenant is, considered at will, but everything below that, including sergeants and lieutenants, are all represented by the FOP.
Absolutely.
And so, and that's another question do I have. So those who serve as officers, are they represented by a bargaining unit? And if so, is it the FOP or a different organization?
No, sir, we all could be a part of the FOP, but as far as.
As
the
law
bargaining-
enforcement officers?
Yes, sir. But as far as their union, if I'm not mistaken, it's AFSCME.
Okay,
So they still have union rights as well as FOP.
okay. And, I didn't realize the Senator Reedy's point. I think part of what he was trying to say, Senator Bidel, and, and I think is pretty clear, but it's not, like, not knowing the hierarchy as it relates to civilian jobs, I think is what MDOT was getting to, but I think that's easily fixed and identified.
Easy to fix.
Thank you so much, Madam Chair.
Okay, thank you. All right. That ends the testimony on this particular bill, and thank you. We're going next to Senate Bill 505, Senator King, Department of Aging, Dementia Care Coordinator, and Dementia Care Navigators. Senator, you have as much time as you need to explain your bill, and you've got a panel, Eric Colchemire, Patricia Grimes, and Brenda Freed, if those persons can come up now.
Thank you,
Now,
Madam
your panel
Chair.
members will have 2 minutes each.
I am chairing a committee upstairs this afternoon, so with your permission, I'm going to give my testimony and then turn it over to this wonderful panel and let them finish up the job.
Thank you.
Okay. I know, I'll miss you too. Madam Chair and members of the committee, as many of you know, my husband Jim passed away 5 years ago from dementia. We were able to keep him at home for a number of years before his cognitive deficits and overall health required more specialized care. During those years of diagnosis and living with the disease, I came to understand how debilitating this disease is and how very little support there is for people caring for their loved ones who are afflicted with this disease. Right now in Maryland, there are more than 130,000 people living with dementia or Alzheimer's disease, and I'm confident that the vast majority of their caregivers are very much like me, no medical background, very little understanding of the disease and its progression, working full-time and not knowing which way to turn. Senate Bill 505 would establish a Dementia Care Navigator program, including the creation of Dementia Care Coordinator in the State Department of Aging and Dementia Care Navigators within each of the state's 20 area agencies on aging. This program would help develop plans for their loved ones' care, connecting them with support groups and other resources, and would also help connect family members who have concern about their loved ones' cognitive abilities with providers who can conduct cognitive screenings and diagnose the disease earlier. This legislation also sets aside funds for a position within the State Department of Aging to provide a statewide coordinator to ensure that local navigators can connect caregivers with local resources as well as those resources that might exist outside of their local area but are available within the state and region. I am offering an amendment with this bill that corrects some drafting changes and conforms the bill to the House cross-file. And I know how disorienting it was for my husband to be away from his home, and I am grateful for the time we were able to keep him at home, but caregivers need resources and support for them to be able to accomplish this goal. Senate Bill 505 with amendments will provide that support to caregivers, and so I respectfully request a favorable report.
Thank you. Are there any questions for the sponsor? Okay.
Madam Chair, I might just add, I got a message from the governor's office that they look at this as a mandate, and they've never liked mandates, and I understand that. This is a pretty important issue, and I think it needs to be addressed.
Well, I guess every bill, if it passes, is a mandate to do what the bill requires, and that's so. Okay. No other questions? All right, then you may be excused, and we'll
Thank you.
hear your panel.
Thanks, Madam Chair.
All right, you have 2 minutes each. We've got,
My name is Patricia Grimes. Thank you for inviting me here today to speak on dementia caregiving and your consideration of Senate Bill 505. Most, if not all of us, have witnessed the profound effects that Alzheimer's and other dementias have on our families and our communities. As an adult home health nurse with Johns Hopkins Home Care Division, serving populations in rural, urban, and suburban Harford and Baltimore counties and Baltimore City, I witnessed the struggle, hardships, and inequities endured by persons caring for those diagnosed with Alzheimer's and other dementias. Lack of knowledge of available resources, lack of resource accessibility, including internet services and the capacity to use information technology, long telephone wait times, long wait times for appointments, increased caregiver fatigue, and contribute to worse health outcomes for patients and their caregivers. Caregiver fatigue leads to self-care deficits, loss of resiliency, and contribute to stress-related morbidity within the caregiver population. Ultimately, these deficits contribute to an increased fiscal burden for healthcare systems across continuums of care in Maryland. I serve many of your constituents who have significant cognitive deficits that are under or undiagnosed. Obtaining accurate diagnosis requires primary care providers recognize the signs of dementia and initiate referrals for appropriate diagnostic evaluation. Early recognition, referral, diagnosis, and treatments are critical for mitigating health decline in patients and their caregivers. Caregivers of underdiagnosed and undiagnosed populations are unrecognized and underserved. They are not eligible for benefits through Maryland's area agencies on aging and are at risk for costly, preventable illness, injury, and hospitalization. Senate Bill 505, a robust legislation, paves the way to begin meeting the needs of dementia caregivers in our state. I appreciate this opportunity to share my experience with the members of this committee and ask you to support these bills. Thank you.
Thank you. Are there any questions? All right, if not, then we'll go to Ms. Grimes.
Chair
Oh.
Kelly and Vice Chair Feldman, my name is Brenda Freed.
Okay,
Chair Kelly and Vice,
okay. I'm
Vice
sorry,
Chair.
I'm goofing up your names. Okay, all right.
That's
Ms.
okay.
Reed.
A lot of people do. Chair Kelly and Vice Chair Feldman, my name is Brenda Freed, and I'm here to ask for your support of Senate Bill 505. Shortly after my dad passed away, I remember my mom saying to me, "Your dad remembered what I forgot." It was then that I realized that her forgetfulness was a little more serious than I realized, and I wasn't going back to Louisiana. It was time to come home to Baltimore and take care of my mom. It was as if she turned off the lights after he passed away. I'm actually getting upset. And her dementia escalated quickly. For me, I had to turn my back on my corporate career of over 30 years, where I'd risen to the level of Vice President of Marketing during my highest earning years. I was taking my mom to her many doctor's appointments, ordering, monitoring, and dispensing her meds, paying her bills, doing her grocery shopping, and when I would take her with me, it would take hours. I would take her out to eat, whatever she wanted to do. I just wanted to make sure that she was happy. That was my objective. I didn't want her to have to worry about anything. I couldn't take on a traditional job, as I had to take too much time off just about every week to care for her. I needed the flexibility to work around my mom's schedule. I did some consulting, Chair Kelly, but I couldn't spend enough of the right hours to do my business and to build that. I studied to become a real estate investor, but working with contractors was beyond challenging, and ultimately they destroyed my business and cost me many thousands of dollars. I never took any money from my mom, and I had to continually take distributions from my IRA, thereby putting any thinking of my own retirement far, far in the future. Yes, I do think about my own future. My grandmother had Alzheimer's. My mom had Alzheimer's. What's going to happen to me? Both my grandmother and my mother had children that loved and cared for them. I don't have children. So I need to be prepared if, God forbid, I fall prey to this horrible disease to arrange for my own care. But I'll tell you that the 7 years I was my mom's primary caregiver, while it cost me dearly financially. But would I do it all over again? Absolutely, because she's my mom. Thank you.
Thank you. Are there any questions?
I can't believe how emotional.
Okay. All right, okay, we'll now then hear from Mr. Eric Kolchmara.
Chair Kelly and Vice Chair Feldman, Eric Kolchmaro, Director of Government Affairs for the Alzheimer's Association in Maryland. Thank you for the opportunity to appear before you today on this legislation. I want to thank Patricia and Brenda for sharing their stories today. I want to thank the bill sponsor, Senator King. This issue is deeply personal for her, as it is for so many of those on the committee and throughout the legislature who understand why support for dementia caregivers matters. Alzheimer's and other forms of dementia is cruel, it is costly, and it takes a toll on caregivers. Nearly 69% of dementia caregivers have chronic health conditions. Roughly 28% of them have depression. And more than 1/3 of dementia caregivers provide over 20 hours per week in care. This legislation before you today is a proven solution. You have testimony in your packet from a Dane County, Wisconsin dementia caregiving specialist named Joy Schmidt, who shares how her state's legislatively mandated initiative, which this bill is based off of, has been invaluable. That program started with just over $1 million and now has over $7 million in funding. It has provided people with information they need to access resources, cope with losses caused by dementia, and remain engaged in their community. It has clear outcomes. Additionally, this funding is available. At the February 17th budget hearing, the Department of Aging the state agency, not the health department, that oversees our state's caregiving work, testified that their agency has $6 million in unallocated American Rescue Plan Act funding, which MDOA has chosen not to use until 2024. That money can be designated to this initiative. I will close with this. We recently finished our annual Alzheimer's Advocacy Week, where we heard from many of our caregivers about the importance of this legislation. People like Vanessa Hooker joined, a Prince George's County advocate, who would have been here today except her mom was hospitalized with issues related to dementia. Thank you to Senator Hershey, who joined us as we heard from a Cecil County advocate who has Alzheimer's and whose wife shared her complicated journey as a dementia caregiver. And we talked with your colleague, Senator Eckhart, who has worked with our dementia support groups and shared that we have been trying to figure out how to help caregivers for decades. Decades. We have no state-specific funding to provide ongoing support for dementia caregivers. The little aid we do have is strained, as Patricia testified to help families whose loved one may show signs of confusion and over time are unable to eat, dress, or bathe without help. This bill presents an implementable and proven solution regarding this disease that disproportionately impacts Black and Latino Marylanders. Thank you for the opportunity to speak today. I urge this committee to pass a favorable report on this legislation, and like Wisconsin, like Florida, like New York, like North Dakota, and like other states, devote state-specific funding to aid dementia caregivers.
Thank you. I do have one question, and since you're from the Alzheimer's Association, you might be the best one for me to ask. How are we defining dementia, given that people have many different physical diseases or deficits that just come with old age that can lead to the kind of problems that you have described and the kinds of struggles for family members and for the person themselves who can no longer function independently? And I just would like to know, is the definition of dementia that you're thinking of with this bill very broad or very limited?
It is limited to what a medical provider diagnoses as dementia. There are many co-occurring chronic diseases that occur as people age. But there are signs of dementia. There are things that each individual can determine when they go to their healthcare provider for a cognitive screening to assess whether they have this specific cognitive disease. And the healthcare provider diagnoses that and helps work to get them on a treatment plan.
I guess I would hate for us, when we pass this is obviously a very much needed bill, to find that some people's source of what leads to dementia-like deficits in their thinking and behavior and so on would be left out just because maybe we've got a limited view of how to define dementia. How would you define dementia?
Can I add to that?
Yes.
When it came to my mom, with my mom's primary care physician, she had been treating her for many years. So, and I used to accompany her to those visits, and she is the one who recommended that we go to Johns Hopkins Bayview with their memory care department and Alzheimer's. So my mom was a patient there for many years, and the first thing they do is that cognitive training, testing, and it's a 30-point test. And just to give you an idea, my mom, when she first went down there, was a 26 out of 30, and every time she went there progressively over the years, it ultimately got to the point where they just said there's no point in doing the test anymore. So we had some, very definite data that supported that this was truly dementia/Alzheimer's.
Okay, let me go back, and then I'm going to call on you.
To add to that, there are very definitive diagnostic tools that can be used when a person is properly referred to a memory type center. So once they get the referral, again, the referral has to be made, but then there's a series of tests, both these cognitive tests, but actual physical tests that can give you a diagnosis of Alzheimer's or Lewy body dementia or microvascular dementia. There are different
Okay,
types of
you're
dementia.
getting at what I'm asking. So when you start talking about microventure, dementia, and so on, because I wanted to be sure when we pass this obviously much-needed legislation, we don't leave out some people because something that we think of as a physical illness might be the initiating cause of the deficits.
Right.
And to leave them out. And so
So,
I'm just
again,
hoping
With the
that,
proper workup, so you have, people who are navigating the system for the stressed-out caregivers, with the proper workup, people get their eyes checked, they get their glasses put on them, they get hearing tests, they get hearing aids added, because if you can't hear, you can't respond to your environment. So, it's a very comprehensive workup, and then you can start dealing with the problem. But you've got to have those navigators there to
Okay.
help these very overwhelmed caregivers.
okay. My concern is that obviously, if it starts by what happens in the brain, we know what we think to call it. When it starts because there are other diseases that impact the operation of the brain and their ability to be self-sufficient, I want to be sure we don't inadvertently leave out people based on what the originating cause is. And so,
It's a very comprehensive, once you get to that diagnostic, a dementia diagnostic workup is very, very comprehensive. So, it involves looking at the heart, the kidneys, the liver, doing blood tests, screening for urinary tract infections, which can contribute to confusion.
okay.
They're
It sounds like we're
comprehensive.
on the same wavelength. I just
Yes.
wanted to be sure. Okay. Are there other questions? Okay. If not, then thank you very much for your testimony. Okay, we're going next to Margot Quinlan, who's favorable with amendment.
Great. Thank
You
you,
have
Chair
2
Kelly.
minutes also.
Yep. Thank you, thank you. Chair Kelly, Vice Chair Feldman, members of the committee, my name is Margot Quinlan with the Mental Health Association of Maryland. We appreciate the opportunity to testify today. We appreciate the hard work of the Alzheimer's Association, and we do support this bill for all the reasons that you just heard. But if you could humor me for a moment and just imagine that your parent or loved one needs help, that they're having trouble with increasing episodes of anxiety or depression, alcohol use, and memory loss. You aren't sure if they have dementia, depression, addiction, but you are at your wit's end and you need help. You call your county area agency on aging. They tell you they have a dementia care program, but they can't address the mental health or substance use concerns. They want to, they need to, but their funding is restricted to just one lane. And Chair Kelly, you mentioned this. A lot of the research shows that one of the first signs of dementia is depression and anxiety. And so, 90% of all people with dementia have a co-occurring mental health diagnosis. So 9 out of 10 people with dementia have a co-occurring mental health diagnosis. And for anyone who's lived through the pains and heartaches of dementia, you might be familiar with this and have seen this, and I've witnessed this too, and it is heartbreaking. And so the reality is we do support this, but we can't separate out an individual who presents with dementia and someone who presents with depression, and oftentimes these are one and the same. And so we would strongly urge this committee to fall in line with the direction that the state is moving. The Department of Aging and the Behavioral Health Administration just last year issued a report on the cognitive and behavioral health needs of older adults. And so there really is this growing body of research that shows that these things are often linked and that the funding should follow that way. And these positions should support accordingly. And so we would support this bill with amendments that would include language around addressing behavioral health concerns for older adults as well, so that our communities and our family members can be served as best as possible. So thank you.
All right. Are there any questions? All right, if not, thank you for your testimony.
Great. Thank you so much.
Okay. Okay, that ends the testimony on that bill. We're going next to Senate Bill 511, Senator Hettleman. And you've got a panel, Michelle Douglas, Francis Lauder, Kimberly Burton. And we are now listening to Human Services Secretary of Aging qualifications. All right. Madam Sponsor, you have the time you need to lay out and explain your bill, and everyone else will have 2 minutes each.
Wonderful. Thank you very much, Madam Chairman, Mr. Vice Chair, members of the committee. I think this might be my first time in finance this year, so
Well,
happy,
welcome.
happy to be here. Thank you. Happy to be presenting Senate Bill 511. This bill is a forward-looking bill, and it won't become effective if it should be passed until the next administration. What this bill does is it sets a floor for the qualifications of the next Secretary of the Department of Aging. And it is based on something that's in current law already. Back in 2004, during the Ehrlich administration, when the Department of Disabilities was added as a department-level agency, we included in statute a minimum level of qualifications for the Secretary of Disabilities. And this bill just is patterned right off of what is currently in law, and it would apply it to the next Secretary of Aging. It says that the person has to have extensive experience and knowledge of aging laws, legislation, regulations, and programs for aging. It actually says right now that they have to hold a bachelor's degree, and I'll get back to that in 1 second. And in addition, it says that in addition to being knowledgeable about all things aging, it will require a commitment to the mission of the Federal Older Americans Act. And that is where the majority of funding for the department comes. It's streamed in from the federal government. So it is really important that that person have a real good understanding of the Older Americans Act and the commitment to its mission. So I'm going to go back to, the committee has an amendment to take out the bachelor's degree requirement. And the reason is because this bill has started to move in the House. And the feeling of the subcommittee over there was that if there is somebody who has had years and years and years of experience and has a lot of knowledge about aging issues, but doesn't happen to have gone to a higher education institution and have a graduate degree, that we should not preclude that person from being secretary. That what's really more important is the experience than the degree. So you have an amendment in your packet to take that out. So without further ado, I would like to pass the baton to the folks who are in the trenches, who are on the ground, who provide the services in each of our counties directly to older adults. And thank you very much.
Okay, are there any questions? Okay, seeing none, we'll go. Michelle, you want to start?
Thank you, Madam Chair, Mr. Vice Chair, members of the committee. Michelle Douglas, on behalf of the Maryland Association of Area Agencies on Aging. They're known as M4A for short. M4A and its 19 associated area agencies on aging represent the front line in Maryland's challenge to meet the complex and varied needs of well over 1 million older adults statewide. And that population is only growing. M4A strongly supports Senate Bill 511 due to the growth, maturity, and evolution in the field of aging, and we thank Senator Hettleman for introducing it. The confluence of the surging senior population, the deep expertise and maturation in the field that now exists, and limited state and federal resources to serve this growing population necessitates a leader with expertise in the field on day one. This bill is forward-looking, as Senator Hettleman said, and is not effective until January 20th, would not be effective until January 20th of the next year. As Senator Hettleman noted, this bill is modeled on what currently exists for the Secretary of Disabilities. I will move on from that. I will say that we are very fortunate here in Maryland to have so much expertise in the field of aging all around the state. And we have an opportunity to pull from that existing expert talent and bring into public service a person who's familiar with the important aging practices and trends to help lead Maryland as our aging population grows. We urge your support for Senate Bill 511.
Let me ask you a question, though. Could we get to a point in time in Maryland where somebody who's nice and popular, and they know a lot of elderly people, would end up with the job without knowing the background and theoretical information that they need in order to do the job well. I keep worrying that in a way, you do make it easier for people who may not have the qualifications to end up in the job, as well as persons who do have them.
So I think that that's what the bill is attempting to address, which is that the qualification would be that and as part of the vetting, that they would have extensive experience and knowledge of aging laws, legislation, regulations, and programs for aging. So that's really the crux of the intent, is to ensure that that expertise, we have professional expertise all around the state. And so to pull that in from day one, to really meet that need.
So I think we all agree on that. They need that knowledge base and practical experience. But don't they need some kind of academic criteria in order that in the future you don't end up with somebody getting the job for the wrong reasons because they're nice and popular and not?
So that was in the original bill because it was modeled on what's there currently for the Secretary of Disability. The reason that the sponsor amendment is before you is because that's the way it was amended in the House. There was concern from a couple of delegates that there may be a few professionals who have been in the field for decades and would bring that deep expertise. But in that time, they didn't previously have a bachelor's degree. So they just wanted to account for not wanting to narrow the criterion for someone who may have been in the field for a long time and bring that expertise. But that's up to the committee.
Okay. All right, Frances Lauder.
Yes, thank you for allowing me to testify today. My name is Frances Lauder. For the past 35 years, I've been involved in the field of geriatrics as both a licensed social worker and a caregiver. As a caregiver, I helped my mother navigate the myriad systems of health care as she lost her independence and finally died in my home under hospice care. As a caregiver, I watched the decline of my husband, advocated for his health care needs, and provided the personal care he needed in the last days of his life. Professionally, I provide behavioral health care services to seniors living in affordable care housing. These are folks who cannot locate a provider who accepts Medicare insurance, nor can afford the expensive deductibles. It is in this role that I strongly support Senate Bill 511. For the first time in history, older adults are projected to take the population lead, and the number of people over the age of 80 is projected to triple by 2050. The new Secretary of the Maryland Department of Aging will need to be able to find policy solutions that address the real challenges we face. In this rapidly changing world, the luxury of learning on the job doesn't exist. The new secretary must be ready from day one to understand the complexities of federal, state, local policies, and how these policies affect the day-to-day lives of seniors. The issues of physician shortage, increasing cost of long-term care, economic disparities, and making technology affordable are but a few of the problems that the new secretary will face. Relevant education, extensive experience, and commitment to the Older Americans Act are but a few of the credentials needed to ensure that Maryland seniors will continue to have a leader ready to move forward. I strongly urge you to support Senate Bill 511. Thank you for allowing me to testify.
Thank you. Senator Kramer?
Thank you for that, Madam Chair, and Senator Hedelman, thank you for introducing this legislation. The only thing I would ask is, in light of the extensive debate over the last 2 days with regard to similar legislation about limiting who it is that may or may not be filling a agency in a department in the state, and disregarding, I think, the notion that someone who's at the helm of a state agency that might be appropriate to have administrative skills, business management skills, know how to run a department, a business, an agency, know how to apply for grants, for instance, to access federal funding, that would be set aside in lieu of very prescriptive standards, and therefore perhaps devalue the individual who is in the capacity as the manager, and in lieu of ensuring there are people within that department and agency who may offer the skills, as is the case in the vice chair's bill, where, yes, we may want to see certain things in the secretary of that department, but the bottom line is someone like Bobby Neal, who was discussed extensively yesterday on the Senate floor, did a phenomenal job without necessarily meeting somehow somebody's desired description as to what that would be. So would you share with me how this intersects with what we've been hearing on the floor the last couple of days?
Sure. Thank you very much for the question, Senator Kramer. And I absolutely think that the skills that you mentioned are very important to being the top manager of of a state agency or any agency for that matter. So I 100% agree, and if that's something that the committee, deems is appropriate to include, I'm all for it. I would say, though, in your reference to former Secretary Neal, I think the vice chair even said that he had extensive experience that he would have met those standards that were included in his bill. Here, too, I think that there are, I don't think we're narrowing the pool, which is, I know, what a concern was of other members. I do think that we're just saying, in an agency that has a very specific mission, that somebody should have quite extensive experience with that mission. Of course, it's also important to have those extra skills, but core to the position is the mission-driven organization, and having familiarity and experience with all of those issues that are only growing and being heightened in this state is critically important.
Thank you.
Okay, any other questions? Okay, all right, and we didn't hear yet from, are you Kimberly Burton?
I am.
Yes.
Thank you, Madam Chair, members of the committee. You have my testimony in support of Senate Bill 511. My name's Kim Burton. I'm here as a citizen of Baltimore County, although I've also been a professional in aging services for more than 30 years. And for more than 20 years here in Maryland, my job has required me to travel and work with the area agencies on aging around the state. I also work directly with program administrators at the Maryland Department of Aging and sometimes the secretaries themselves. I can tell you, as you can probably imagine, that Maryland Department of Aging has a wide variety of obligations serving an increasingly diverse population with a broad range of needs. In addition, there's increasing need to work in cross-collaboration with the sister agencies such as the Department of Health, Department of Human Services, Department of Disabilities, even the Department of Transportation. And within that work, there are high expectations for a solid level of experience and understanding for the Secretary of the Maryland Department of Aging. Having worked with the past 4 secretaries in some capacity, I can tell you there is a steep learning curve for the secretaries to understand operations and administrative responsibilities for multiple programs. There's a steep learning curve to know key decision points and issues of the program, to operate with fidelity to the requirements of the Federal Older Americans Act, to provide leadership and support to the 19 area agencies on aging, and to understand the growing needs and complexities of Maryland's older adults who outnumber school children and have a multitude of issues and concerns that we haven't seen before. I also work in the field of behavioral health. We have a growing number of older adults experiencing addiction, experiencing homelessness. I can only foresee that we're going to need to grow programs with an understanding of what these different populations need. Senate Bill 511 establishes requirements where there currently are none to ensure future secretaries hit the ground running and are immediately prepared to review and formulate policy recommendations with the governor. I urge your favorable report on this very important legislation. Thank you.
Thank you. Are there any questions of this witness? Okay, thank you very much to this panel. Now we have two additional witnesses, Carol Lenhard and Isabella Shykoff. And you have 2 minutes each.
Good afternoon, everyone. My name is Carol Leinhardt, and I'm here today representing the Maryland Senior Citizens Action Network, which is a statewide coalition of organizations who work on behalf of the health, housing, and quality of care needs of Maryland's older citizens who are of low to moderate income. My career began in 1980 with a master's degree in aging from the University of Maryland. My testimony here is based on 42 years of experience in the field, so I guess you could say I'm of the old guard. I have been the director of the Hartford County Office on Aging. I'm a past president of the Maryland Association of Area Agencies on Aging, and currently serve as the co-chair of the Maryland Senior Citizens Action Network. So you might sort of say that I've seen it all. And one of the things, you've got my written testimony, and I'd like to just talk about the fact that there has been such a dramatic change in the field of aging in terms of the field maturing over the years and expecting more and more of those who work in that field. Back when I started my career, we operated primarily on a social model where seniors would gather in senior centers, they'd have meals together, they'd have activities, and they would be less isolated, and that was sort of the major goal. We were a social model. We might say that we were fun and games back then, but we have moved to serious business. Over the years, as seniors began to grow older, remain still within the community, and then their health care needs began to affect the kinds of programs that we were able to offer. And we moved from that social model to more of a medical model, which is dramatically more complex than the original social model that we dealt with. So what we see is the need, literally, for people who are in leadership positions in the field of aging to have very strong experience. The Older Americans Act, for example, is loaded with restrictive kinds of requirements, and you have to meet those requirements in order to get the big bucks that we get from the Federal Older Americans Act. So you have to adhere to those. You have to understand those. And that's why we are recommending that SB 511 would guide the selection of future secretaries of aging so that they literally, as the group has said, can hit the ground running, because really there isn't a lot of time to waste. When you're 78, when you're 80, you don't have a lot of time not to have your needs met. And I think about the senior care program, the Medicaid waiver program, where the offices on aging are now almost asked to keep people out of nursing homes, to keep them at home and in their communities for much longer. And so we feel as though this set of minimum qualifications would serve the citizens of Maryland. And I thank you for the opportunity to testify, and we look forward, or we hope and pray, for a favorable report. Thank you so much.
Thank you. All right, and Francis Lauder.
Good afternoon, Madam Chair, members of the committee. My name is Izzy Shykoff. It seems like yesterday, but it was 1986 when I began my professional career with the Senate Finance Committee. So I was where Tammy is sitting now. Obviously, it was in the James Building, but a long time ago, I worked for the Senate Finance Committee.
Welcome
and after,
back.
It feels good to be back. Following that, I became an advocate for seniors and senior care providers as the executive director of Lifespan, which is a senior care provider association in the state of Maryland. And I worked there for many decades. In my capacity there, I had the opportunity to work with the past 4 secretaries of aging. They all had their strengths. But I have to say that it has been over 20 years, and since Sue Ward, and 3 secretaries ago, since we've had a Secretary of Aging who came to the job with previous experience in aging. And I think as the field has evolved and as things have become more complex and the demographic has grown, it's time. I urge your favorable support for Senate Bill 511. I think there are a lot of reasons why it's important now. The pandemic has laid waste to this sector of our population. Of the 13,000 plus people who have perished in Maryland from COVID, most of them were elderly. The demographic realities alone demand it. The workforce crisis that's been precipitated by the pandemic has created huge, huge problems for care and quality caregiving for the elderly who need it in this state. Affordable housing, affordable assisted living, we need more of this. So I urge your favorable report on this bill. I think it is a beginning to elevate and prioritize senior care public policy making in the state. This bill just sets minimum, a floor, standards for the future leaders for this agency. Thank you.
Thank you. Are there any questions? Thanks for your testimony. All right, we're going next to Senate Bill 624. Senator Heddleman again. Assisted living programs, assisted living referees, requirements and prohibitions. If you'll come up and let's see, we have as your initial panel, Patricia Hall, John Benbrook, and Paula Sotir. Your panel members will have 2 minutes each. You take the time you need to explain your bill.
Thank you very much. Thank you very much, Madam Chair. This bill came to me from some constituents who are small business people in the community and were talking to me about some of the challenges they are facing. They are assisted living program referrers. And tell you a little bit. This committee, a couple of years ago, put some protections in place to make sure that organizations that were referring families who are often coming in vulnerable situations and making referrals to assisted living programs are doing so on the up and up, and that there was a modicum of protections in place for those families and those older adults to ensure that the programs that they were referring to were licensed and appropriate. So we did that a couple of years ago. This bill really builds on that and continues to put some protections in place in an area that's largely unregulated in this state. If I had the need, I have parents in their 80s, and fortunately they are in good health. But if I was in a crisis situation and I needed to find an assisted living program in my community, I could do that a couple of different ways. Many of us have seen on television and elsewhere that you can go online and you can use certain businesses that will gather information from you and make referrals to places in the community. You can also seek help from other small businesses in our community who know the programs on the ground and who will get to know you and will get to know what the needs are of your loved one and will make an appropriate match. What this bill does is it puts in place some protections for those programs, for all of the referrers. It says that the people who work for them have to go through they have to go through background checks. It says that they have to maintain liability insurance. It says that there has to be transparency between the relationship between the organization and the client. And it says that the way that these businesses are structured is I don't pay them. They get compensated from the assisted living organization. So those agreements are between the referrer and the assisted living organization. But it makes sure that if the organization is sharing that information, that private information about me and my loved one, that they are doing so safely and with all the appropriate HIPAA requirements, for example, if they're sharing medical information, and that they're doing so with my consent. So puts in place this modicum of protections in that relationship. It also makes sure that there aren't particular conflicts of interest. So I can't take a power of attorney from a client. That would be inappropriate. And it prevents the sale of that client information to a third party if they don't know that. So I am going to let my panel talk about some of the specifics of the way this industry and area operates, so you can hear more directly from folks in the field. But really, I see this as consumer protection, and I think that you'll see from some of the testimony from the Attorney General's office and others that this is about protecting people at particularly vulnerable times in their lives when they may be going through a traumatic time of trying to find services to help an older adult who in their family who needs some more care. And it is also about making sure that there's transparency in that relationship between the referrers and the clients.
Okay,
So-
before we go to your panel, what would you say are the top 2 or 3 protections in the bill that you're interested in being sure we guard?
Providing insurance, liability insurance, providing background checks for the employees, and making sure that somebody can terminate a relationship with the referrer at any time. Those are, I would put at the top of the list, and I don't know, others might disagree with me, but those are among them.
Okay, are there any other questions for the sponsor? Okay, then we'll go to your list. Let's start then. Oh, yes. Let me call on the Vice Chair.
Yeah, just very quickly, Senate President, we all talk about the Senate family. We have two former members of the clan, if you will, in the audience. I'm going to acknowledge former Senator Rona Kramer, I believe, is somewhere here in the House. Is she, or did she walk out? Our Secretary of Aging. Okay, I was told she was here. Okay, well, and we've got former member of this committee, the Finance Committee, Senator Jim Mathias in the front row there. So.
Okay.
Okay, never mind. I guess I shouldn't have done that.
Okay, we'll start with Patricia Hall.
Good afternoon, Madam Vice Chair and the members of the committee. I'm here to support Senator Hedelman and certainly Bill 624. My name is Patty Hall, Patricia Hall, and I'm the resident of Baltimore County. I am also the owner of Senior Care Partners, a private placement company that works on the service model of being a personal consultant helping families. So I work directly with them, I meet them, and we kind of go hand in hand through the process. I operate in Baltimore and surrounding counties, and for the past 13 years, I have helped numerous families with any types of questions from in-home care to care in assisted livings. So that is the background from which I come today. I'm also the president of the Baltimore County Provider Council. We're a membership organization committed to building a professional community that improves the lives of our older adults. This bill brings a lot of awareness for needed requirements and guidelines in an industry that, when I first started in 2009, had none. And I was probably one of the only ones that I knew of that was actually acting in the profession the way it is today. We know that anecdotally because in 2020, there was a bill put in place that required all of us to create a registry with the Office of Healthcare Quality. Prior to that, there was no registry. You didn't know who was who, and everyone was just kind of running around doing their thing. So we've made a really important step in kind of corralling us, if you will. That needs to be kind of furthered with this current bill, because any industry, any business needs regulations, requirements, criteria. And this industry is no different. We are dealing with families in a crisis, in very difficult situations. They seek us out for our professionalism, for our knowledge, to help them through a very difficult time. Without the business insurance, the criminal background checks, HIPAA compliance, and consent, as well as transparency of how the relationship is working, we are putting a lot of people in harm's way and in a disservice. Again, this is a very stressful time, and this transparency is critical. It is time to adopt all providers, regardless of their service model, need to follow certain criteria so that we can raise the profession of everyone involved. That will help us do what we want to do, which is helping those that need our help, the older adults and their families. I thank you for your support and your consideration of our testimony.
May I ask, how do most of your clients find you? Do they find you in directories of certain types, or through certain organizations, or through the newspaper, or what?
Yeah, so that's a great question. I would say that my colleagues, we all have different sources, but we get our referrals from social workers, from medical doctors and nurses within the community, certainly word of mouth, other trusted advisors, so financial advisors, accountants, anyone that has the trusted ear of their clients and know that they're going through a challenge often refer to people in this industry. I'd say most of us also have some type of website, so yes, people could find us on the web, on the internet, but most of us are kind of, I call feet on the street. Like, we're out mixing it up in the community, meeting people, getting involved in aging groups and networking and things of that nature.
Okay. Well, for whatever criteria the committee and the Senate ends up blessing in the General Assembly for giving these bills, which are very important, it might be helpful for us to know more about what are reliable sources for finding the kinds of persons with the kinds of skills and services that you offer. I'm right next door to Shelley in Baltimore County, and I'm not sure I would know how to find you. You know, if I knew of people in my district, I'm in District 10, she's in 11.
So honestly, I know I hear that quite a bit. I'm sure my colleagues hear it. And often, you know, we'll hear people say, if I only would have known about you when I was going through this with my dad or my mom.
So that one thing that's important often to the public is to know you've got some kind of a connection with a major social or religious or cultural organization in the community, or a social work organization that they know of, so that if you're connected with them or if they are recommending you, they know what they're doing. So we need to think of that before we finish with the bill, because we don't want you to go lacking if you have the ability to help all of the kinds of people with the various needs that have been discussed today. And we don't want those people to suffer in silence, not knowing that you're right around the corner or at the next intersection and they don't know about you. Okay.
Excellent point.
All right, we'll go next to John Benbrook.
Okay, thank you, Madam Vice Chair, members of the committee.
I happen to be Madam Chair.
Madam Chair, I'm sorry.
Okay.
It's my first time, I'm a little nervous.
Okay.
So, Madam Chair. My name is John Benbrook. I'm the president of Oasis Senior Advisors, a national referral business. I'm also a board member of the National Placement and Referral Alliance. At Oasis Senior Advisors, we support thousands of families around the country and in Maryland, specifically helping them through their stressful and their incredibly complex journey to identify and also provide the support for their seniors in their lives. I understand there's two business models being represented today. This committee doesn't owe anything to either one of those models. This really isn't a turf war in any way. What we owe is the right to families to give what's in the best interest of those families. I think models aren't constituents, people are, and I think that's super important. With that said, The online model is going to suggest that they have an agreement to provide a lead, and if that lead goes and places to a family, well, then they're compensated. I think it's really important that we're not talking about leads today, we're talking about families and the care and the need of that family. So that's a super important part. You know, these people are in crisis, as it said previously. They're in crisis, they're vulnerable. And I think it's really important that this bill, it's clear that this bill is about doing the right thing to protect our seniors and their families. You know, giving them the choice, the right of choice. Using a real estate model, if an agent provides you an MLS listing of 15 homes in your area, but you choose to work with another agent that provides a higher level of service, that would tour with you, that would help you with the paperwork, that would give your expertise, or that would give you their expertise to help you complete that process. I think it's, you know, the idea of sending just an MLS wouldn't be the act of completing a sale or completing that process. The procuring agent in that case would be the agent who personally met with the family, toured the family, and helped them in their final decision. I would argue that if you asked that family who represented them from beginning to end of that process, it would be that touring agent or that procuring agent. It's about family choice and giving that family the ability to choose. We also may hear the online agency state that a contract, they have a contract to be paid first if the state can't get between those two parties. And I think there are several scenarios that make it objectively impossible to perform a contract. One type of situation that would lead to that impossibility of performance of a contract is there is a supervening impossibility. For instance, a contracting party may be able to raise the defense of supervening impossibility if, after the contract was already created, legislation was passed that would make it impossible to perform that contract. If this legislation were passed and the state of Maryland provided families choice of who they could work with, it would be a supervening impossibility event for the senior housing community to satisfy their agreement with the online agency and stay within the guidelines of the state law. So I want to thank you for your time. I support the Senator's efforts in this bill, and I urge you to pass SB 624.
Thank you. Senator Jennings.
Thank you. I just want to understand the analogy you gave and see if I understand correctly. When you talked about a real estate agent. So you're saying if I sign with the gentleman to my right, he takes me, or he sends me a couple of houses to look at, I don't like any of those, but then I sign with you, we go look at a couple of houses, but we come back to one of the houses that he picked out, originally sent me, I think I'm still obligated to him because I signed a contract with him. Initially, correct?
So it depends, hi, this is Paula. So the idea is you didn't really sign a contract. You got on MLS, they just sent it to you through the email. So there was no contract there. Now, the contract is with the community. Does that make sense? So that referral company, the online referral company, has the contract with the assisted living. They didn't sign a contract with the client. So can the client decide
so
to
then-
change?
But then the facility's on the hook then, because they signed a contract with that company. So if I pick, let's say this is a nursing home now, he showed me a couple, I didn't like them, I came to you, you showed me a couple, but then I think about it, I go back to the one he picked. That company's still obligated to deal with him.
In the current state, for sure. Right?
Yes.
But that's not about family choice. It's allowing the family to choose who they want to work with.
Talk
But-
into your mic. You can,
but-
it's movable.
But the family, what I'm trying to figure out here is, it's a contract between the company and the facility. The family's not involved. They're not paying, correct? The facility pays.
So so a little clarification. So yes, the facility pays and the facility has a contract with all of these folks and the online folks. So the contracts exist with all of the different parties. The issue is kind of what the relationship is between me as the searcher and them as the provider of information, right? So you have folks here who are on the ground, who are with them, who are literally meeting with them, spending time with them on the phone, literally often taking them to facilities versus an online model of sending you a list of providers in your community. Right? There's a difference
No,
between.
I understand a difference, but to me, a contract's a contract. That's the issue.
But I don't know that I have a contract with you when I click to talk to you. That is the issue, is providing the transparency, am I right? Providing the transparency to the customer and the client potential. So I go online because my mom falls and I can't provide the support, whatever. I'm in a crisis situation. I need to get her more support and I need to find an assisted living program to be able to help her. And I go online and I look, I Google because I don't, like the chairman, I don't know who to go to in my community. And I Google assisted living in Pikesville, Maryland. And so I come up with, I come up with a name and I call that number or I click and I get somebody on the phone and they ask me basic information and then they send me a list. We actually had somebody do this in our office. We had one of our interns kind of go through and compare and see what the service was like. And it was a very short period of time that they spent with the person on the phone and they then sent, gave a list of providers in the community. And that was the extent of the relationship. I didn't know that by doing that I was obligated to them in some way, right?
Okay.
So you understand the difference? And on the other hand, then let's say my mom doesn't, 2 years pass, I never put her in assisted living, but because I had been sent the name of that facility by that original online referrer, they're claiming me as their client.
Got it.
And now, 2 years later, I have this relationship with people in the community, and they're out of luck because they grabbed me 2 years ago online.
Okay, Senator Reedy.
Let me follow up with that, because I'm very interested in this issue. I've been reading a little bit about it here and the bill. And I feel like the bill gets into a lot of stuff, and my sympathy is with the small business, the local person doing this, believe me. So I understand, I think I understand the concern, maybe, I'm not sure. You just talked about, I don't know who I, as the consumer, who my contract is with, but it sounds like I have no contract because I'm not obligated to use who they send me. I'm simply giving.
Correct.
But what's the harm? I mean, whose ox is being gored in that situation? Like, I'm looking for information. This company is collating it and giving it to me for no charge to me.
Right. So,
And so then I go find somebody else, and I know
Right.
some other people that testify, which I definitely want to hear. I go find somebody else to help me. Maybe I'm,
Right.
networking, and I meet somebody, and they say, I can help you.
Yep. They can't get paid then.
Okay, and I feel bad about that, and I do not, what I'm about to say is not meant to dismiss the concern, but why is that a consumer issue?
Well, it's a piece. It's just a piece. And it's important for me to know who my relationship is with, right? In terms of who's helping me.
Well, yeah, but
And what they can
if they
do
help
then.
you,
Sorry?
they're gonna help you, so,
But it's also making sure that the actors who are providing these services are doing so in a transparent way.
So-
Like,
so
for
do the-
example, the information that I share,
yeah.
like if I share personal medical information, I want to make sure that that's protected.
Is that not happening right now?
Right, correct.
So there's, the big guys, not to be pejorative one way or the other, but they're sharing people's private medical information, or? Okay, I'll conclude, that's what I'm trying to kind of understand,
Yep.
so,
And you'll
yeah.
have an opportunity to ask them, but we want to make sure that they don't.
Okay, well, okay, thank you.
Senator Klotzmeyer.
I just want to know, you're not the assisted living, right? You're the one that's going out trying to find assisted living. But are you in one little area, or do you go throughout the whole state? Or where do you, or you have like a network of places that you contact? I don't know.
Yeah, so I'm Paula Sotier from Care Patrol. Care Patrol covers the whole state. We're a franchise, so we have 6 different franchises that cover the whole state. So we do refer. If I get a hospital client from Johns Hopkins and they live in Anne Arundel County, I will then refer to my colleague in Anne Arundel County. So in Baltimore, there are 600, Baltimore County and City, there are 600 assisted livings, 600. I have gone to 450 personally, and I know the advantages and disadvantages of each of those. So that's where local and online, that's where local helps, because we've actually gone to those. Does that make sense?
Yeah, so I guess we're between local and regional or national.
Yeah, and we're national also, but, you know, you want Maryland, so we cover all of Maryland with our franchises.
Okay, thank you.
Okay. Seeing no other questions,
I don't think she got
I'm about to call on her.
Yes.
Okay, so you're next.
Hi, thank you, Madam Chair and Vice Chair and the members of the committee. My name is Paula Sotier. I am actually the president of Care Patrol Baltimore, and I'm in favor of Senate Bill 624. A little bit about Care Patrol and me. So we cover Baltimore County, Harford County, and Baltimore City. We have placed 1,500 people in those areas. I've been in this industry for 8 years. I am a nurse for 40 years. It's hard to say that. I got my master's in health administration at the University of Maryland. I am a certified senior advisor. I also help people with doing assessments. I'm certified to do home safety assessments as well as dementia training. So what I want to talk about today is I want to support Senator Hedelman with requiring us to follow the HIPAA laws with sharing information. I know that was discussed. So why now? Why do we want this? Well, first of all, as we've heard even before us, you know, this industry is growing, and there are a lot of people that are going to be seniors right now. But what's really happened in our industry is for the past 3 to 4 years, people are waiting longer and longer to go to assisted living, right? The families they want to stay at home, and I'm all in support of that. But from a medical model standpoint, they need higher level of service now. So, and this has really happened through COVID. With what's happened with seniors through COVID being isolated, we're seeing when we get a referral that their medical needs are really high. So reputable placement advisors will find out their health care today and in the future. And what they want to do is they want to refer safe care options to them. I get a majority of my referrals, and a lot of us do, from hospitals and rehabs. Hospital social workers as well as care managers are giving us a lot of medical information. I'm able to get the history and physical, the physical therapy notes, the occupational therapy notes, the psychiatric notes, the nursing notes, and the medications. I get all that information, and about 18 months ago, my company was given access to some hospitals' electronic medical record. So what do we do with that information? Well, what we do with that information is we read it, and as our clients, we're touring with them, right? We're out on the, touring with them in their assisted living. When they choose assisted living A, I then share all that information to the assisted living. They need that information because they need to know if they have the capabilities to actually accept that client. So that's really, really important. I actually find it sort of unbelievable right now that rehabs and hospitals would even consider giving medical information to anyone but their family without a HIPAA agreement signed. And we do that. We take that extra step. I think most importantly about getting a HIPAA agreement is there's an unintentional consequence. And what that means is that we have to speak to the right person. We have to speak with the senior, the power of attorney. We have to speak with the family, because the only way to get that HIPAA agreement signed is by going to the people that can sign it. So they are clear on who's working with them. They know that it's whatever company is really working with them, supporting them through this process. There is also transparency on who is looking out for the best interests of the client. Sometimes what could happen, a neighbor could call or someone that just knows that there could be a problem, but we have to go that extra step to find out the person that really can make the decision and help that senior through this process.
Well, we have gone almost twice the time that we have.
Okay, sorry. All right, so one other thing, we have to stop the questionable practice of selling the information to third-party vendors. What happens is they sell the information to like hearing aid companies or hospital bed companies, and I really don't think that's what the senior will want. I urge the Senate to support Senate Bill 624 to protect the vulnerable Maryland seniors and their medical information.
Thank you. Are there any further questions? All right, thank you very much, and that ends the testimony.
There's two
Oh,
more.
I've got some more people here. Yes, we do. Okay, we'll get our second panel. Kristen Zimer, Maria Heckman, all right, you have 2 minutes each. You may state your name and go ahead.
Thank you, Madam, and honorable panel. My name is Kristen Zimmer. I own Wind Chimes, a private referral agency in Carroll County, and I am in support of Senate Bill 624. I apologize, I'm nervous.
You're doing just fine.
I am born and raised from Carroll County. I live just 13 miles from the orchard that my grandmother grew up on, Thelma Mae Dittman. She was born one of 8 children whose primary objective was to work their father's land. Only having an 8th grade education, what Thelma really learned in childhood was hard work and true grit. The kind of true grit that allowed her to work 2 full-time jobs while raising her own children, including one at Black & Decker, 3rd shift factory work while her sons were at home sleeping. As a young child, my memories of Thelma are synonymous. Work, work, church, and then more work. When I would go visit her, she would often put me to work. Truth be told, I didn't like going to her house as a child. However, as I grew into young adulthood, my outlook on Thelma changed. Behind the hard work was strength, perseverance, and a true value system. I would visit her often and tell her about my life. Her life had been much harder than mine, but she would listen and she would provide strong but loving feedback to all of my woes. I started to see her for who she truly was, not a taskmaster, but a titan. When I was 25 or mid-20s, my grandmother started to decline. Her physical and mental abilities got worse and worse.
Now, you don't have but 2 minutes. You want to tell us why you want us to
Yes,
pass this
ma'am.
bill.
Yes, ma'am. So true grit that once gleaned in every fiber of her being was now hard to find. There were many professionals who helped her along the way, from her aides, her doctors, her financial planners, all professionals that were required to adhere to a high level of standard and ethics. However, had my family used an agency like mine, that agency would not have had to live up to any standards. Referral agencies are just like any kind of healthcare worker and should be held to standards as such. The intimate nature that we have with our aging clients necessitates the kind of ethics and standards that you find in this bill. Why? Why is that important? Because even titans grow old and vulnerable. Even titans need protections in place. So I urge you, senators, to pass Senate Bill 624 to protect our once titans, our aging seniors.
Thank you. Are there any questions? Okay, then we'll move to Maria Heckman.
Madam Chair, Vice Chairman, and members of the Finance Committee. Thank you so much for your time today. My name is Nina Heckman, and I am one of the 2 community sales directors from Springwell Senior Living who are here today in support of Senate Bill 624. Springwell is a retirement community located in Baltimore City. We offer independent living, assisted living, and secure memory care options. I have been working with seniors to transition to Springwell Independent Living community for over 10 years. Our responsibilities include many, including introducing families and their loved ones to Springwell and to help guide them in deciding which one of our products would be the best fit for them to be successful. As a community sales director, I have worked with many local referral advisors present here today, as well as many online agencies. In my opinion, both of them can be valuable resources. The demand for community care is growing. Seniors and families are waiting longer to make this move, and it can be an overwhelming undertaking to understand all the options. Often it is a crisis, a bad fall, a bout of pneumonia, perhaps COVID, a heart attack, or simply dementia that lands a senior in rehab where they learn that they can no longer return to their home safely, and they often have a week or less to make a decision. It is more than picking a great apartment. They need to understand care levels, services offered, associated costs, and community cultures, to name a few. So there are local referral advisors who meet with families. You've heard all about it a little while ago. They know the families, they spend hours with them, they do tours, they understand what they need, and they help them pick out communities. Of course, the other option, as you've heard about, are online agencies. Often families in need will research a community such as Springwell. They click on Springwell, and without knowing it, they have gone into the online agency world, and they've entered into an agreement with an online agency. Many times people come into our offices and describe that they had no idea that they, while doing an internet search, looking for the phone number, that they're inundated with phone calls and emails that they were not expecting. So the problem is that quite often families sit in our office and they want to work with a smaller agency. But a community the size of Springwell, we can't accommodate both contracts. We honor the first one. An online agency sends out referrals to us. We have 5 days to turn them down. If we don't turn them down, then we're obligated to pay them. So this is one of the problems for a community. If a family wants to use a small agency that has vetted the community, that has been here, that has met with us, who knows what we offer, they often can't because we can't pay both. So we strongly believe that the consumer should understand fully the process of entering into any referral agreement. The terms should be transparent. It should be their right to choose who represents them in this process. I urge all of you to pass Senate Bill 624 to help protect our vulnerable seniors. Thank you so much.
Thank you. Senator Reedy?
Thank you, Madam Chair. My constituent from Carroll County did a great job.
Thank you.
I do have a question, I think, for you, if it's all right. Do you think that there's a place for both of these services? Because we're in a complicated space, it seems like to me, as I look at all this information.
Right.
I don't want to be, there's some great questions that have been raised, but I also don't want to just, I'm not a big fan of like picking winners and losers. So, I mean,
Well, as I
where's your
said,
thought on it?
we've had success. I think some of the online agencies definitely provide services. Some of those sales advisors, they're honest. They've taken the time to learn about our community. I think one of the problems we run into are the ones who've never been to Springwell. We get many referrals that the location is bad, or they're looking for heavy care, Or the other issue is people don't know that they've, been contacted by a Place for Mom. So when I call them to introduce myself, to explain about Springwell, the families are very, very frustrated.
Because they didn't feel that they gave
I think if they knew, if they were told, if you are entering into a contract with us, it's great that they don't have to pay anything, but if they understood that if they want to work with somebody else, they can't, because we can't pay both.
I think my problem is I'm looking through, I definitely see there's some legitimate concerns, but I'm also looking through that they do notify people of how it seems like looking online, that they try to tell them kind of how the process works, but they don't go, maybe it's not very in-depth, I don't know.
From what I can tell, and the, emails we've gotten back, is they send out a report, and they'll send them out 5 or 6 communities who will be contacting them.
Okay.
But there doesn't seem to be any terms there that you are obligated to use a Place for Mom. If consumers understood that, some people would be fine with that.
I guess okay, yeah, I mean, I obviously having a local person you could go to is I would think would be ideal, but there are reasons why you might not have that opportunity or might want to do something different. I'm just trying to sort through this very, very interesting issue, so thank you both.
You're welcome.
It's occurring to me that while the issue happens to deal with persons seeking services who happen to be elderly and so on, we probably could have had somebody from JPR who does contract law to have been here listening, but I'm going to...
We have the vice chair.
But that's, yeah, okay. Okay, thank you very much. I don't see any other questions of this panel. All right, we have 2 additional persons, 3 additional. Frank Boston, Gary Papilski, and Jim Rosenthal. These are unfavorable. You have 2 minutes each.
Yeah. Good afternoon, Madam Chair, members of the committee. I'm Frank Boston III. I am here today on behalf of A Place for Mom and Caring.com, and we oppose this bill. I certainly understand the stress that's been talked about because I am going through it with my mom as we speak. So I clearly understand the issues here. This bill, just to cut to the chase, let me just tell you, there are no senior citizens, there are no moms, no dads here to testify in favor of this bill. Why? Because they pay nothing, not a cent. All this conversation about us and the contracts with them, this, that, and the other, our contracts are with the assisted living facilities. This is a fee grab. This bill seeks to restrict our ability to get compensated for the work we've done. We are referrers to assisting living facilities and home care, care. Because we have good marketing, someone who lives in Nevada and who has a mom in Maryland may reach out to us because it's where they go in a time of stress. They look online. We all do. We were just here 2 years ago to fix all of the issues in this space. Senator Hedelman did a great job. Disclosures, and other issues regarding licensing and all of this. Senate Bill 966 or 996. We did not oppose that bill. We had some things we didn't like, but we did not oppose that bill. In fact, that bill even required us to refer to places outside of our network for which we don't get a fee. We comply with it. But this is very similar to procuring cause. Thanks, Senator Jennings, for the question. In a real estate transaction, right, you come to me, Frank Boston, realtor, and I represent the realtors. You come to me and you say, I show you house A, B, and C, okay? But 2 months later, you get friendly with someone else who knows your cousin, and then you go to that person and you use that realtor, and they show you house D, E, and F. 3 or 4 months pass, and you say, you know what? I like house A that Frank Boston showed me. Well, I am entitled to that fee. It's called procuring cause because I showed you the house that you ultimately went to. If that same scenario, that client chose to go to house D, E, and F, I don't get a fee because I was not the procuring cause. I was not the original person who put the marketing into showing you the place, who did the research, who narrowed it down to 4 facilities so that you could feel comfortable. You know, that's the point. We have local employees here who know the lay of the land, who they speak with. No one else is complaining about this in the state. Again, no senior citizens are here because it's 0 cost to them. I don't even see the assisted living facilities here because this is not a problem for them. This is a money
grab.
grab.
One lady from Springwell.
Yeah.
Yeah, the most recent person, she was.
Oh, my apologies. We saw you one person from an assisted living facility here. Madam Chair, members of the committee, this is a money grab. That's all it is. It's not fair. These are other businesses trying to take away our fee that we earn because our business model was successful and theirs is not as successful yet.
All right. Senator,
Yeah, just, I understand your analogy to the realtor, but this is a little different in that we're talking, let's go to Senator Hedelman's point about disclosing personal health information, okay, the HIPAA issue. So I didn't hear you say anything about that, and that question, I'd like to hear the other two panelists. So this idea that that information online, we're looking at some online stuff, you go in, very personal information, what protections are afforded somebody that discloses that in terms, and you could wait the other two, but Frank, do you have any response? You kind of glided over that. I thought that was
Yeah,
one of the more significant points.
On the specific HIPAA questions, I will defer, but I'm glad you asked me the question. On the issues of, in the bill, liability insurance protection, done. We have no problem with that. We already do it. With national companies, we have to. Background checks, done. We have no problem with that. We already do it. Some of those things were already being done because, you know, obviously these are things that people want and see, and we don't want to get sued. And if we do, we want to have protections anyway. On the HIPAA, I'll defer.
Okay,
If
thank
you
you.
want, I can answer the HIPAA
Well,
question
you
now.
could make it as part of your testimony when you can.
are there any other questions of this witness? Okay, then we will go next to Gary Popilski.
We're going to switch it up. It's
All right, okay. Jim Rosenthal?
Thank you.
Okay.
Thank you, Madam Chair, Vice Chair, and members of the committee. Thank you for your time and your thoughtfulness. I got involved in this industry soon after losing my dad to Alzheimer's and having to make the tough decisions that you've heard about, and not aligning myself with a Place for Mom or Caring or the previous testifiers, and realizing I didn't understand all my options and didn't go to sleep with the confidence we were doing the right thing for my dad. So I have dedicated my career to making the process easier and helping as many seniors as we can. And I thought it would be helpful to take you through a classic customer journey in working with us, which is a son goes home for the holidays and realizes that his mom is not doing as well as he had thought and needs something else and probably needs senior
Now,
living.
you don't have but 2 minutes, so you really want to help us with the things we're confused about.
Yep, cut me off when you want.
Okay.
So the son goes home with this new stress, typically, as most of us do, goes online, finds our website, which has extensive information about senior care, and if he wants to dive deeper, he can either fill out a form or call us. He's then connected with one of our highly trained family advisors, and the conversation they have starts with really a discovery of the mom's needs. What are her care needs? What's the budget? What are the geographic locations they want to be in? As well as everything from, does she have a pet? We need to find a place where, you know, she can take her dog. Does she have hobbies that are important to her? And we need to find places that can appeal to those. Are there dietary issues, religious issues? It's about this time in the conversation where you can sense the weight being lifted off the son's shoulders as he realizes he's not doing what he thought, which was finding a nursing home for his mom to go to die. He's choosing between some fantastic assisted living communities where his mom's going to thrive, surrounded by people who dedicate their careers to helping seniors be comfortable, healthy, and stimulated. We then match them up based on those needs with typically around 4 communities that.
You're gonna run out of time, and we need to
Gary
know
will pick it
about
up.
the legal issues.
Okay.
And about who is, holding whom hostage, okay.
Okay, so we talk about these 4 or so communities with the Sun. Assuming there's some interest, we ask for consent to share the family information with the communities. And once we get that consent, and when we hang up the call, we then send that information to the communities and send the community information to the Sun. So we also further nurture to make work with the family and with the community going forward to try to find a fit. What's important to take away from this is all of our services are free to the Sun, the senior, and to the family. We only get paid if the mom moves into one of the facilities to which we referred her. The other thing that's important is we only share information once we get consent. We do not sell the information. We do not send it around to other places. We get consent for the communities we talked about, and then we send the information to those communities.
Okay, now you've done a good job of explaining your services and how it works.
Thank you.
What about this bill is problematic?
So the only part of the bill that we greatly dislike, when the sponsor was first asked, what are the 3 most important things? Insurance, not an issue, we've got plenty. Background checks, not an issue, we thoroughly train and do background checks on our advisors. Termination, we don't have a problem with termination. Of course, any customer can say, I'm done working with you. What we have a problem with is we've gone through this whole process, and since we only get paid if the senior moves into one of the communities, we've actually been successful in this process, and yet competitors of ours want to take away our ability to be paid because they met that same senior after we did and had the same recommendation. We have no problem with.
So it's only if the second or third party provider of services makes the same recommendation that the earlier one did.
In essence, yes, because we wouldn't be paid, if they recommend something else and the person moves in, we wouldn't have been paid anyway. We have no problem with that.
And so is this bill, in your estimation, taking away the ability of the priority that should be recognized? That if the person is going to go to the same place that the first or second company has recommended, they've got to pay the initial company that who provides
Correct.
service.
We have, in our agreements with the communities, it's well understood that if somebody has already introduced that senior to them, we don't get paid. So, for instance, the largest chain in the country is Brookdale. We get an email from them every day with, I don't know the exact number, but like 20 duplicates. We had sent them something yesterday, that person was already in their system. We get it. We weren't, that's fine. That's the way.
So the way you're looking at this bill and would like us to see it is that the bill is changing that arrangement such that a secondary or third party who later recommends what the initial party has already recommended could get the pay that you are entitled to because you made the same recommendation and you did so earlier.
Really, because we went through a whole, yes, but remember, we went through this whole process to get there. It's not, a lot of resources in terms of our people and our information were invested to get there, but yes.
Well, everybody did the work, but you did it earlier, and you made the same recommendation which they accept later from a different company, right?
Yes, we take pride that they moved into one of the places we suggested would be a good fit.
Okay. Senator Klossmeyer.
I was wondering, do you ever get to the point where people come back and complain to you? I'm sure you can't be stellar without a complaint or two, but, you don't have like the Attorney General's consumer protection coming down on you or anything like
No.
that? And the way I'm looking at this, it's just 2 different models of what you're doing.
It is, and there's a place in this country for both models, and they both serve a purpose.
Okay. All right. Are there any other questions? I think we sort of got it finally. Is your hand? All right, the final witness is going to testify now. Now, you're Gary, okay.
Hi, I'm Gary Papilski. I'm General Counsel of A Place for Mom. I want to thank the committee for allowing me to talk today. So, there's been a lot of testimony heard on this bill, and I think there's just a few things I'd like to clarify of what was said. So, we've been characterized as the online services. We're not the online services. Do we spend a lot of money making our website perform and make sure that it serves the consumers that we're looking to target? Absolutely. Do we buy internet advertising? Absolutely. But I will tell you, we have over 450 people who do nothing but talk to seniors and families all day making those recommendations. We do not make recommendations online. We're not a bank rate where you go in, type in your information, it spits out, okay? We have, if you come, a large portion of our clients come in through a telephone call, through our advertising, print, and TV. If you're coming in through our website and you're filling out a form, it's basically just asking you for your address and the area so we can know. You might get asked 4 or 5 quick screening questions that are kind of click right, click left, and then you're going to talk to somebody. And you're going to talk to somebody for somewhere between 20 minutes and an hour. It's an emotional phone call usually. I've listened to these. There's tears, there's crying, there's empathy, and we try to learn what the family's wants and needs are, what's best for the senior. And then and just to point out, until this point, you haven't done anything. The only thing is when you click that lead form, you've authorized us to contact you, to call you on an automatic dialing system, because we have to conform with the various consumer and privacy laws out there, okay? It's only after we've gone through this conversation and we've come back and said, hey, we have some communities we think would suit you, and note that it's generally only 4 communities. We're not shotgunning it. We're not trying to, play tag and say, got it, to some of these other referrals agencies. We're going to say to you, is it okay if we send your information to these 4? You say yes. At that point, only those 4, Madam Chairman, are the ones that we would say that we should be entitled to a fee. We've done the work. We've made the recommendation. And furthermore, even if you're not happy with us, you can go to another agency at any time. You want us to stop calling you, you send us a notice, we stop calling you, and as I'm sure the committee knows, there's various consumer laws in all 50 states that require us to do that. We would do that if it didn't, but that's what it requires. So it's all very well regulated at these points.
Okay.
And our thing is, if we've made that recommendation, if you go somewhere else, you get the 5th, 6th, 7th, 8th, let them get their fee, they've earned it. Frankly, we haven't done our jobs. But if you're going to go to one of the ones that we've recommended, we've done our job. Our job is, we're a referral agency. We're supposed to make you a referral that suits your needs and matches them. And if
Okay.
you've gone there, we've done it.
I'm sorry we don't have a lot more time. I've got 2 questions. The Vice Chair has the question, Feldman, and then Senator Reedy.
Okay, so this will be something hopefully Mr. Boston can. Okay, so I'm looking at the bill. So just so we're clear, because you reeled off stuff that's all, okay, so you all are fine with every part of this bill. The only issue that I've heard is on page 3, subsection 2, there's just this one section that talks about the assisted living program may not pay a fee. That's the only part of this bill that's in dispute. Everything else in the bill, because you signed up unfavorable. It wasn't favorable with an amendment to delete that section. It's kind of a different position here.
There are other problems. To your point, we're going to address the HIPAA for you, and then the also written document piece.
Yeah, so I think there's a number of provisions that, we find problematic in this bill. I think the first is the HIPAA requirement. So HIPAA is a federal law. It either applies.
We're aware of what it is, so
Right.
that's helpful to know the HIPAA requirement. And what's the second
It either applies or it doesn't. We don't really understand how it applies in our relationships in terms of the data that, we've done the legal analysis, we've gone to outside counsel. In terms of the information that we gather, which is not the kind of information that they've talked about receiving, we don't get that kind of information. HIPAA does not apply to us as an organization. If it did, we would have to comply with HIPAA. I'm not sure what an agreement with the consumer really means. And for other agencies that are getting information from hospitals and other things, There's a legal obligation on those hospitals to make sure that when they share data, it's in a HIPAA-compliant manner. I'm assuming that the right, regulations and forms and agreements have been followed, but we don't really see how it's applicable to this industry in terms of the way it's done, and we don't see why that requirement needs to be added to a bill in Maryland. It's a federal requirement that's either there or not. So that would be one piece. Another piece is talking about getting a written contract. So one, we're not quite sure what the contract is that we're supposed to get because we don't have a contract with our seniors, number one. And the second thing would be just the method of the contract and the way the bill was written. The bill was frankly written, really to almost discriminate against companies like ours that are trying to do our business in the state. And, we obviously are doing our business over the phone. Almost impossible to get a written document and to deal with the mechanics. There's lots of other ways and lots of other words that could be used.
We're not going to be able to go on and on. Let's see, Senator Reedy may have additional questions that you might want to answer.
Well, I appreciate, thank you, Madam Chair. So I appreciate some of what I've heard, because I'm trying to just understand this whole issue better. And so I just want to be clear, you guys, your contract is with the assisted living, same as the other group that we've heard from, right? So there's no contract with consumer. About the HIPAA thing, you're just talking about HIPAA, but basically, is there ever a time that either company you represent becomes the power of attorney for somebody?
No.
I just saw power of attorney mentioned someplace, so just.
That would be a breach of ethics, absolutely not.
Right, okay. And there was another issue brought up that I thought was interesting about the sharing of information. I was actually surprised that assisted living would share medical information. I mean, I assume there's a reason that it happens when someone's an on-site person, and there may be very valid reasons. But you guys don't get any of that? You don't get medical information, or do you? Or is there ever a case where you might?
We try not to get it. We focus, when I talked earlier about finding out the needs of a senior, the needs we're talking about are activities of daily life. So it's do they drive? Can they bathe themselves? Can they dress themselves? Can they feed themselves? Do they need help with their meds?
But you don't get what meds they have, right? I mean, it's
correct.
Okay.
Correct. We wouldn't know what to do with that.
Okay, all right. I guess in some ways I'd wonder if you might need it, but if you don't, that's good to know just for information. And then I guess the other question I wanted to clarify is what stage we move forward. So they go through maybe an online portal and they select that they'd like to be contacted. You contact them, and then there seems to be some dispute with some folks saying it's not a very long phone call. You guys saying it's, it ideally is a lengthy conversation. I guess that can be, depends on what your definition of lengthy is. I'm a millennial, so some people my age don't like to talk on the phone at all. I don't mind it, but some people don't like it. So it's a conversation, and then it's only after they give consent for you to give their name to someone that you do, correct?
We do a discovery, find out what are their needs. We match them up. We talk about potential communities that we think make sense. They agree, and then we ask them for, we say, okay, the next step is we will share your information with the community so they can get in touch with you.
Do either one of your companies share the information with anybody else besides that?
Not without their consent. If in our conversation with them, it's clear they need in-home care, then we will have a similar conversation.
But you would ask them.
Yes.
You can't just be like, they don't start getting ads for in-home care on their social media because they talk to you.
Correct.
There's privacy obligations. We have privacy policies that are on our websites that we adhere to.
That you adhere to,
and obviously,
or you'd be sued.
That's a very tightly regulated area, especially when you're dealing with personal information.
I was curious about that.
Okay.
All right. There's a lot more here, Madam Chair, but thank you very much.
Senator Bidle.
Thank you, Madam Chair. So I was out for part of your presentation. I apologize. I had a bill hearing in another committee.
I can start it over. Is that all right?
No. But I have a pretty simple question. You keep talking about sharing information. Is that an agreement in writing, or is that just oral that you say to the potential patient, can we share your information? Or do they sign something in writing that it's okay?
It's verbal. It's over the phone.
It's all verbal.
And we record it and maintain it.
Okay.
If we ever need it.
So it's recorded?
Yes.
Thank you.
Okay. All right. I think we've got a better idea of the industry, and we've got a better idea by now of the other side. And so we are going to end the discussion on this particular bill. Thank you very much.
Thank you.
We're going next to Senate Bill 518, Senator Augustine. Senator, you have a panel, Lynn Lucci, Brad Phillips, and James Mathias. Senator Mathias, okay. They may come up.
Yes, sir.
Okay. Senator, take the time you need to explain the bill, and each of your important, you got an important panel there, but each of them has 2 minutes.
Thank you, Madam Chair and members of the committee. Senator Malcolm Augustine here requesting a favorable report on Senate Bill 518. Colleagues, this bill establishes the Career Pathways for Healthcare Workers program to provide matching grants to hospitals or related institutions that pay for training programs attended by healthcare workers, with the goal of providing increased opportunities for healthcare workers to receive training across the state at our historical Black colleges and universities and/or our community colleges. The governor must include in the annual budget a bill and appropriation of at least $1 million for the program. Colleagues, we are facing a severe health care workforce crisis. I don't need to repeat any of that for any of you in here. Unprecedented vacancies, competition for existing healthcare professionals, and those who are there, who we depend on for care, are most vulnerable in the moments, are absolutely exhausted from trying to keep up with this healthcare while being understaffed. It's all hands on deck to work on this problem. This bill is part of the near-term and long-term solution to increasing the education and pipeline of our healthcare workers. The good thing for me about this piece of legislation, ladies and gentlemen, is that there's not a cost for these employees. That's the point. The point is that it's going to provide that the additional grant from the state, okay, that's matched with an investment from the employer in order to increase the education for these healthcare workers so that they can improve in their skills, become more skilled, move up in the ranks. And it really is an all-inclusive thing in that we also are encouraging our HBCUs and our community colleges to participate in this so that we're able to strengthen their programs, build them up, so that we will then be able to increase this pipeline over time. I'm very excited about this piece of legislation in this way, and I would ask for a favorable report on Senate Bill 518. In my panel, obviously, I'm joined by my very good friend, and as was taken by the Vice Chair, my thunder for the former member of Senate Finance, Senator Mathias, and as well as our other colleagues. And thank you so much, Madam Chair, for listening.
All right, you have 2 minutes each.
Go ahead, Lynn.
Okay, thank you, Senator Augustine, for sponsoring this bill. My name is Len Lucci. I'm here on behalf of 1199 SCIU, United Healthcare Workers, the largest local of healthcare workers in the United States and the largest representative for nurses in the state of Maryland. I'm very pleased to be joined here with Senator Mathias and Brad Phillips of the Maryland Association of Community Colleges. And I also want to give a good mention to the next witness, Brian Frazee from the Maryland Hospital Association. Our two organizations have been working together to address the healthcare staffing crisis in the state of Maryland. Maryland is one of 4 states in the nation that will experience a shortage of over 10,000 nurses by 2025. Even before the pandemic, a study found that we needed more than 40% more direct care healthcare workers to meet the needs of our state by 2024. And of course, the pandemic has made this much worse. This bill is a solution because it will fund training programs that will build a robust healthcare workforce. It will do that by creating a fund for employers to apply for matching grants for the training programs and for those training programs that go through the 4 HBCUs and for the community colleges. By creating a career pathway program, the state can mitigate the need for current and future healthcare workforce demand. And so 1199 SCIU asks for your favorable report on Senate Bill 518.
Thank you. Are there any questions? All right, then we're going next to Brad Phillips.
Well, good afternoon, Madam Chair, Vice Chair, and members of the committee. My name is Brad Phillips, and I'm the Executive Director for the Maryland Association of Community Colleges. And on behalf of all of Maryland's 16 community colleges, I would like to thank Senator Augustine for introducing this legislation. And I want to really talk about two aspects of it. First, workforce development, and second, career pathways. First, workforce development is one of the major innovations of the modern community college. It is a model that rarely gets the attention that it deserves, and it's really designed to really help with workforce shortages. In a workforce approach, curriculum is driven by the needs of local industry. Course delivery systems are sufficiently flexible to meet the diverse needs of student and industry, and students experience a mixture of work-based learning and classroom learning. The features combine to help students succeed at post-secondary education and gain important training, and I might add with less than necessarily a four-year degree. Senate Bill 518 represents a recognition of the changing face of post-secondary education, and it incentivizes community colleges to do more to collaborate with industry partners and tackle the significant workforce shortages that Lynn just mentioned, with 10,000 nurses in the future workforce shortage, as well as many other areas in the healthcare industry. And the second is the idea of career pathways. Career pathways are important recognition that many already in the healthcare industry are actually looking for job growth and new opportunities. We serve a diverse population of Marylanders who would like to pursue new skills and new opportunities, yet are unable to afford to do so. Like Senator Augustine said, the funding in this bill will allow that population to receive the training at no cost. As the largest provider and trainer of numerous healthcare professions in the state, Maryland's community colleges ask that you support this legislation, and thank you very much.
Thank you. And now we'll go to our former colleague, Senator Mathias.
Thank you, and good afternoon, Madam Chair Kelly, Vice Chair Feldman, members of the committee, Tammy and David. It is so good to be back home, to say the very least. But I just want to take a quick moment and thank my friend, Senator Augustine, for a bill of action, Senate Bill 518, and very quickly ask for a favorable report. You've heard it all. We've heard it all. We've heard it here before. We're hearing it again. The problem only becomes more exacerbated. I also bring greetings from UMES President Heidi Anderson. We are very, very fortunate at University of Maryland Eastern Shore to have 8 healthcare curriculum. We are working through the challenges. You don't need to know because you're in the trench with those challenges every day. We thank you for the work you did on the HBCU settlement bill. We were challenged by COVID, as the entire country and world has been, and now this is the time that you can act and do something to help all of us. It incentivizes our employers, and it incentivizes our healthcare workers and our employees. And now our challenge at UMES and other institutions is retention and recruitment. This allows both things to happen, and it adds to this severe crisis and shortage. I thank you very much. I'm proud to be home, and I ask for your favorable support.
Are there questions? Senator Klossmeyer.
Thank you. It is a wonderful bill, and you guys have done a wonderful job. But when Len first talked to me about this bill, I suggested looking into the EARN program, because there's tons of money in that. Every year, it seems like they put more money in that. And when EARN was established, it was called the Employment Advancement Right Now. And if we can look into that and get more money, that would even be better. So it's just a thought, and I take EARN very personally, because it was my bill along with Johnny Olszewski, and we really, really worked hard to get that. So if we could look at that, and I will be looking at that, but as well. So
we will, Senator. Thank you.
okay, yeah, it's just a suggestion.
Okay, I have a question. I'm going to ask Lynn to try to help me. I'm not sure still exactly what the bill does. What is the ask?
So,
On the mic.
employers can apply to the state for a matching grant to send more of their employees to a community college or a HBCU, either to enter the healthcare profession or to upgrade their certification in the healthcare profession. There's a limit of $50,000 per grant and $1 million for the entire program.
Okay. Can employers in all fields do this, or are they limited?
Just the healthcare field.
Healthcare, okay. All right, any other questions? All right, that's helpful. Okay, thank you very much.
Thank you.
Okay, we're going now to Brian Frazee, who is favorable with an amendment.
Thank you. Good afternoon, Madam Chair, members of the committee. My name is Brian Frazee, here on behalf of the Maryland Hospital Association in support with amendments on Senate Bill 518. As you just heard the previous panel speak to, Maryland is experiencing a healthcare workforce crisis, and this was building before the pandemic and has been exacerbated by multiple COVID-19 surges. Just to provide some context, in the last 5 months of 2021, we have had an increase of 50% in nursing vacancies across the state. And we know that we can't only just rely on building the pipeline of healthcare workers, but also focus on our existing workers and how to provide career advancement opportunities for them at every level. And so this bill would provide funds to supplement the programs that hospitals already have. And you'll see in my written testimony that we are suggesting 3 amendments, all of which we are working with the bill sponsor and SCIU on. Those are, we believe that the list of training programs should be reviewed by the department, and participating employers should have a say based on the high demand positions that are needed at any given time. We also recommend that the General Assembly doesn't legislate a certain salary increase for the program. And lastly, we suggest that the grant program funds be separate from the existing funds that are already negotiated between the labor union and the hospital. So I too want to acknowledge and thank SEIU, Len Lucci, and the bill sponsor for their partnership and collaboration on this effort, and we'll look forward to continuing working with them to move this issue forward. Thank you.
Thank you. Senator Bidle.
Thank you, Madam Chair. So, thank you, Mr. Frazee. My question is, the hospitals are already doing something like this? Are they already matching or providing education funds for?
Yes, there are, several hospitals have existing worker retraining funds and other funds to help their workforce advance or go to different training programs. And so what we're saying in our amendment is this should be separate from that, and a separate program that it doesn't kind of flow through those existing programs that already are negotiated.
So yesterday, I found about 5 programs to encourage healthcare education workers. So this, no offense, Senator Augustine, but this is one more. There's so many different bills out there that we somehow need to get all the bills together, and it's just, there's a lot of good stuff, but it's just a lot of different bills.
Understood. The need is great. The need is great, so.
Thank you.
Okay, are there any other questions? Okay, if not, then that ends
Thank you.
the testimony on that bill. Thank you. Okay, we're now going to Senate Bill 548, Senator Lamb, local health officers removal, grounds, and process. And I'll call up your panel. Dr. Larry Polsky, Dr. David Bishaya, and Kathleen Hoke. Senator, you've got the time you need to explain the bill, and the other witnesses will have 2 minutes each.
Sounds good. All right, well, thank you, Madam Chair. Good afternoon, members of the Finance Committee. I'm Clarence Lamb, Senator for District 12. The purpose of Senate Bill 548 is to establish stronger guardrails to protect local county health officers from improper and undue terminations without cause or justification. As all of you are aware, our local health officers have been on the front lines combating the COVID-19 pandemic in our local communities. They have a tough job of balancing the needs of our local counties with the requirements of being a state employee while serving as an extension of the Maryland Department of Health and implementing state policies. Ideally, the policies of the state health department would be aligned with the perspectives of local jurisdictions and their elected officials, but that's not always the case, unfortunately. As state employees, these local health officers have a duty to adhere to and remain consistent with state policies and to follow the facts and science, even when they may not be popular with local jurisdictions or their elected leaders. In normal times, public health works invisibly in the background, safeguarding our communities and our constituents. But the course of this 2-year pandemic has been anything but normal, And so our local health officers have been leading their respective departments, not only with the daily tasks of COVID tests, vaccinations, outbreak investigations, and monitoring infection rates, but in today's highly charged and contentious environment, it has thrust public health into politicized debates that pit good science and sound policy against misinformation and oftentimes public whim. As a result of this and other reasons, we've seen at least 7 health officers retire, resign, or forcibly removed during the course of this pandemic. With 24 jurisdictions here in the state, losing 7 health officers in 2 years of time should ring alarm bells. This bill attempts to address a specific circumstance where a health officer is terminated by the secretary with the consent of local officials. In current statute, this is current statute, in order to become a health officer, potential health officers must be approved by the local jurisdiction's county government before being appointed by the secretary into their role as a state employee leading that jurisdiction's local health department. In our state, the vast majority of local health department employees are actually state employees, including our local health officers. And these 24 local health departments are really extensions of the state health department at the local level. These local health departments and their health officers must carry out state health policies and programs while also taking on local initiatives for their own jurisdictions as well. When looking at terminations, this is just terminations in current statute, the current statute permits the removal of a local health officer with the concurrence of a local county governing body and the Secretary of the Department of Health. It is important to note that except in a few cases, the local county government body is either the county council, the county commissioners, or the Board of Health, which in some instances is actually the elected county council itself. The current law is silent on reasons that health officers can be terminated, and any information relating to the removal is confidential. The reason we're here with this bill today is because one of those jurisdictions' local elected officials undertook a concerted and coordinated effort to oust their local health officer simply for doing their job. Dr. Bashai, the former Harford County health officer, was simply doing his job in carrying out the policies of the Maryland Department of Health when the local county council bowed to public pressure from a small group of activists by recommending his termination with little warning, public notice, or explanation. Rather than acknowledging that Dr. Bashai was carrying out the policies of the Maryland Department of Health, the Secretary agreed to terminate Dr. Bashai without public explanation and directed the Deputy Secretary of Public Health to inform Dr. Bashai of his decision. You'll hear from Dr. Bashai shortly himself, but I think in this, his experience brought to light some glaring shortcomings of our current law in protecting our health officers from political or public pressure, particularly when local elected officials bow to misinformation and the Secretary fails to stand up for health officers simply for doing their job and carrying out departmental policy. SB 548 will establish clear criteria for the removal of local health officers consistent with similar public officials and create an appeal pathway through the Office of Administrative Hearings. The bill would amend Maryland Code relating to the removal procedure to bring these positions, the health officers, into alignment with similar local officials such as county superintendents, whose removal procedures serve as a model for this bill. The bill does not remove the county or the Secretary's authority to remove a health officer. It merely specifies that the local county health officers can be removed for reasons specifically pertaining to immorality, misconduct in office, insubordination, incompetency, and willful neglect of duty. These terms seem to be very reasonable justification for removal from office and are directly copied from the removal statutes for county superintendents that currently already exist. This bill would also require that health officers be provided with written notification of their removal by the Maryland Secretary of Health, and that the notification must outline the reason or reasons for removal. The bill permits the health officer to request a hearing before the Secretary following their concurrence with the county government body within 10 days of receiving notification of their removal. And lastly, if the health officer further contests their removal, they may appeal that decision to the Secretary to be heard at the Office of Administrative Hearings, or OAH. The ability to appeal to OAH further ensures that the removal of a health officer is subject to an objective review as a safeguard to ensure that the termination is consistent with one of the 5 reasons stated in the bill. We have been in touch with OAH, and they have no objections to these provisions. There is a sponsor amendment in your packet that strikes the mandate that the meeting with the Secretary be held publicly, as well as some unneeded language relating to counsel. This amendment does not alter the intent of this bill in any meaningful way. Local health officers are public servants charged with the leadership of public health measures in their jurisdictions, and throughout the pandemic, they have been instrumental in leading our communities in the efforts to mitigate the harm of this virus that has been inflicted on public health. These officers are apolitical, selfless civil servants whose leadership must be shielded from the threats and political manipulation we've seen them endure throughout the pandemic. Though they do not have the fame or notoriety of Dr. Fauci, and many of them don't want it, they are oftentimes working tirelessly, putting 60, 80, or more hours each week in just to protect their local residents and communities. They must be allowed to do their job and carry out the policies of the Maryland Department of Health without the threat of removal by a local jurisdiction that disagrees with state policy, and without the risk that the Secretary will not intercede to be an objective decision-maker in protecting these public servants who are just doing their job in extraordinarily difficult circumstances, especially now. In conclusion, I would like to address some of the oppositional points that you will find in your packet. You will only hear from one stakeholder in opposition, and that is MACO. MACO argues that this bill isn't needed, and in an ideal world, that would be the case. However, our world is not ideal, and this pandemic and the recent incident in Harford County demonstrates why MACO's position is myopic and fails to reflect reality. You will hear from MACO, and this is in their written testimony, that, quote, in a situation in which a health officer was to disregard local, state, or federal guidance and breach the public's trust, this bill would potentially protect them from termination. That's simply not true. Disregarding local, state, or federal guidance sounds plainly like insubordination, and that is grounds for termination in this bill. MACO also makes a further argument of politicizing our local health departments. To quote their written testimony, they state, quote, the bill removes the discretion and autonomy available to newly elected county leadership, and our shared constituents will lose the ability to use elections to impact policies, end quote. Their written testimony also cites that these local health departments, quote, play an important role in government operations, including the enforcement of nuisance violations and oversight of restaurants and other facilities, end quote. None of us disagree that these are core functions of a local health department. They're bread and butter responsibilities that should be conducted and conducted well by any health officer, not politicized with the changing leadership as a result of a local election. MACO's argument, in my opinion, doesn't hold much water for two reasons. One, counties currently do not have complete autonomy over selection of their local health officer. They do not have current autonomy based on the current statute. And number two, if a local health officer isn't responsive to these bread and butter functions of the local health department, then they could be terminated for incompetency, which is one of the 5 reasons stated in this bill. I would pose that any legitimate, non-politicized reason to remove a health officer is already accounted for and permitted in this bill. MACO's position fails to recognize the reality that we've seen, and that our health officers are being hamstrung or even being fired just for doing their jobs, just for carrying out and implementing policies in alignment with the Maryland Department of Health. And finally, these criteria for removal of local health officers, as I mentioned, were drawn from the statute for the removal of local superintendents. And let me be clear, these protections aren't novel. They already exist for local superintendents. Even with elected boards of education, we've put these simple, basic, and reasonable provisions in place to protect their local school superintendents. As applied to the local superintendents, this existing statute has not led to any issues with superintendents being unresponsive or unaccountable to their local boards. And so similarly, we do not believe that these basic protections afforded to local health officers, who are also an extension of the state as state employees, will affect the ability of local elected governing bodies to carry out basic public health functions. And with that, I'd like to thank my panelists, Dr. Polsky, who's the legislative chair of MACO, and the Calvert County Health Officer, Kathy Hoke from the University of Maryland, and also Dr. Bashai himself. Dr. Bashai has only limited time to present his testimony and to recount his experiences. I will note to the committee and the public that we will be having a hearing before the Joint Committee on Fair Practices and State Personnel Oversight next week on Tuesday, March 1st at 3 p.m., where Dr. Bashai will be afforded an opportunity to go into further details as to what he has experienced from his local officials and from the Department of Health. And as the Joint Committee Chair, I invite and welcome all of you to watch the upcoming testimony next week before our Joint Committee to understand why this bill is critical to ensuring that we continue to attract the best leaders to serve as our county health officers, particularly when 7 of the 24 of them have left their roles in just the past 2 years. And with that, I want to thank the committee and urge a favorable report.
I want to thank you for really laying out the parameters of the problem very well.
Thank you.
Are there questions? All right. Senator.
Yeah, Senator Lamb, just real quick, just so I understand, so the secretary has to concur with the local governing board in order for the removal to take place, and yet the first stop for the guy who's been let go is to go to a hearing with the same guy that concurred. So I guess that's one question that, intuitively it seems a little odd unless Well, I don't know, that seems a bit odd. The second would be timeline. If that is the first stop, I think we should have some kind of timeline parameters. All it says is, he's afforded a hearing, and then the secretary, for whatever reason, can then sit on it for 6 months and make no determination? I mean, it seems to me, just in looking at the process here, if we're going to go that route, the secretary after the hearing should have to make some kind of determination so that then if an appeal to the Office of Administrative Hearings is in order, I can see in a scenario where this thing can kind of get dragged on, and it is a local health officer. You don't want that being in perpetuity. So I just raised those 2 points. You say you borrowed it from another. In the case of education, I mean, is the secretary also have to concur in the removal in the other scenario? I mean, the superintendent situation is the.
I don't think the secretary has to concur, but they have an appeals to the State Board of Education, to MSDE's board.
Okay.
And obviously, that doesn't exist for MDH, and that's
Right.
why we had to create this kind of a scenario. Now, I think Dr. Bashai can speak to the fact that he actually never had the opportunity to meet with the secretary. And, and that's why I think we need to,
Okay.
the secretary has the authority to terminate him, but he never actually had the chance to even speak with him
Okay, I
directly
got
about
it. So then there's still a role, this idea of going back to the secretary, even if he may have just signed off, he may not know much about. Okay, I still think the timeline, I don't want a secretary after the hearing to sort of sit on it in perpetuity, so.
I agree with the timeline
Yeah.
issue. That's a good point.
Senator Reedy?
Thank you, Madam Chair. A quick question. You brought up the superintendent issue. I mean, we actually did have a big conflict in one county with the superintendent and a school board, and it did go to the appeals process at the state board, I believe, recently, a few years ago. But one key difference I see is that a superintendent is dealing in a contract. There's a contract with the superintendent of schools versus in this bill, if we pass this bill as is, and you tell me if I'm wrong, you basically, once you become the health officer, you're a health officer for life unless you are immoral, commit misconduct, or insubordination. Is that, or incompetent, or willful neglect of duty, correct? I mean, if we pass this
I don't
bill?
think that's true. I think because this is something that has the consent of both the local jurisdiction and the secretary, that there is a means to be able to ensure that there's proper stakeholder input from both the state and county level. Because these positions are state positions. They're not purely county positions, right?
The county
And so-
funds it, correct?
I don't know if the
county funds the county health
funds, I'll have to look into that. I'm not sure if they fully fund
Maybe not fully.
the positions, but I think in many instances, a lot of these positions are in part funded by the state, as well as some of the other employees in the local health departments. And so it needs to be they need to work together as a partner in making these decisions, but there also need to be proper guardrails in place for that.
Well, I agree with the idea of proper guardrails, and if there's not a clear process in law now that the secretary does at least have a meeting and get involved if there's a dismissal, I think that's totally legitimate. I just worry about saying you can't ever have a removal for anything other than someone doing something wrong or being just grossly incompetent, which would also be wrong in office. You can have situations where there's a personality disagreement or they don't feel they're working well together. You mentioned officers leaving, 7 in the last 2 years. We only have one, it sounds to me like, and I don't know all the circumstances, and I'll look forward to the testimony. There's only been one that's been dismissed. It's been an incredibly stressful time for everybody, but for our health officers, it's not unreasonable to think there would have been some turnover, just normal turnover. I just question whether we need to do a whole new law because of one instance.
Sure. So it's actually not just one instance. And I think if you tune into the joint committee hearing, you'll also hear from the former Montgomery County health officer as well, who experienced a lot of the same challenges, did not rise to the level where he was forcibly terminated. But I think there are a lot of things that can take place that are untoward towards health officers that fall just short of the threshold for termination by the secretary that still harm our local health departments and also our local communities.
Okay, I'll check that out, and I do have a concern. I don't want it to set up where we pass a bill and it's like health officer can't really ever be removed unless there's something really wrong. We don't want another situation like we have with the State Board of Elections where someone's in the position for life unless they're removed by the state senator or something. So that's just my concern. Thank you.
Okay.
You did go through a recitation of at least 5 different causes now in law, right, for the removal. So if any of those were in place, all right. Are there other questions? All right, then we're going to hear from the panelists. All right, Dr. Polsky, do you want to go first?
I would be pleased to. Madam Chair, members of the committee, my name is Larry Polsky. I'm here on behalf of the Maryland Association of County Health Officers in support of SB 548, and I promise I'll keep it to 2 minutes. The goal of SB 548 is to better insulate health officers from increasing outside pressures so they can base health decisions on the best scientific and medical information available. In an age where public opinions are swayed by social media content filled with questionable and at times erroneous health information, it has become ever more important to provide a buffer for health officers who answer not only to elected officials, but to the professional and ethical standards of the boards of physicians and nursing. Events of the past 2 years have demonstrated that health officers operate in a different arena than most appointed officials. County government directors who serve at the pleasure tend to oversee inherently political departments such as planning and zoning and economic development. But regardless of public opinion polls, viruses will continue to spread, failing septic systems will pollute our waterways, fentanyl will cause overdoses, and salmonella will trigger outbreaks. Health officers also are duty-bound to carry out state regulations and orders from the Secretaries of Health and Environment that don't always sit well at the local level. In order for health officers to consistently and effectively protect the public's health, we need an extra safeguard against termination solely because our professional duties conflict with local preferences. In conclusion, in an era of lost experience in the public sector, SB 548 will provide stabilization where health and lives literally hang in the balance. The Maryland Association of County Health Officers thanks the bill's sponsors and co-sponsors and asks for a favorable report. Thank you very much.
Thank you. Are there any questions? Okay, that was good testimony. All right. Dr. David Bashaya.
Madam Chair, members of the committee, my name is David Bishai. I'm a physician and the former health officer of Harford County. I'm here to speak in favor of the bill. My county still has not found a replacement for me. Montgomery County also lost a health officer. They still have not found a replacement. It's turning out that the abuse of health officers in one county is poisoning the well for all of the other counties in Maryland, which is why the state should take action on this issue. I would point out that transparency is really what is added by this bill. It does not take away the accountability of a health officer. If I were serving under this new bill, I would feel just as accountable to conduct my affairs in a competent and judicious manner. So we're adding accountability. I want to point out that the current version of the bill that we're changing actually requires confidentiality. It insists that the deliberations be kept secret. And that is what has emboldened and empowered local governing bodies to act in a feckless and capricious manner. They know that they never have to explain their actions. And so even though in my case it was a political action, they can still dodge behind the fiction that it was a personnel matter. So when feckless politicians in one county abuse a public servant, it really spills over to all of the counties in the state. Who would want to serve in a position like this when we see this epidemic of councils and governing bodies acting in a feckless manner? So what happened to me is instructive of the inadequacy of the current statute. Under my leadership, Harford County was simply following the executive order. I issued no special local deviations from the policies that were endorsed by the Hogan administration. There was no policy question that the citizens were angry or agitated about. They simply didn't like the executive order and were angry about having to wear masks, and added to their protests, we should also fire the health officer. That was the mantra. We don't like masks, fire the health officer. And that's what led to the political posturing. And it was a minority. After I was terminated, there was a petition to reinstate me signed by 1,500 Harford County residents. And there was night after night of angry protest about my removal, also creating unnecessary disappointment in the citizens who the county council was meant to serve. So in closing, let me restate the reasons to support this bill. I think it adds accountability that the citizens wanted and wish they'd had prior to my termination. They were angry after they lost me, and your actions might help prevent that from happening. I think the secrecy is wrong. It prevents accountability by these local governing bodies, and they're using it as a smokescreen. And the last point was that when one county acts like this, it really makes it difficult to recruit top talent to do this important job.
Thank you very much. I don't see any questions. You did a good job. All right, and we'll go to Kathleen Hoke.
Thank you. Madam Chair, members of the committee, I'm Kathy Hoke. I'm a professor at the University of Maryland Carey School of Law, where I teach and practice public health law. I have the distinct pleasure in the capacity of my job to get to work with all of the local health officials from around the state, and I have for more than 20 years. I'm here today in support of Senate Bill 548 in part because I believe these officials are entitled to the modest level of job security that they're provided for in this bill. They are, as Senator Lamb aptly described, hardworking public servants. But I want you to also look at this bill as one that is designed to protect public health. What this bill is really designed to do is to allow the health officials who have experience, education, expertise in public health, and know their communities well, and have been given a breadth of power from you, as well as have to follow the laws that you pass, but allows them to do that in a way that protects and preserves public health. This bill will erase from their decision-making the fear that they will lose their jobs because a segment of the population will be unhappy with their decision. That's what this does, and it doesn't provide a tremendous hurdle. In employment law, this is the smallest speed bump to termination, the 5 provisions written out in this bill. And so I think if you look at this as removing politics from public health, which we needed before the pandemic, but the pandemic has made perfectly clear that we need to do that, it will allow the local health officials to do the work you've asked them to do, that the counties have asked them to do, and that preserves and protects public health in their communities. Thank you, and I urge a favorable report on SB 548.
Thank you. I don't see any questions. Oh, Senator Augustine.
Thank you, Madam Chair. And it could also be for the sponsor and for the health officer. What if a health officer had made like a decision that wasn't in the best interest of public health, and then, but then they weren't, but none of these indicators would be there? Like, what happens in that scenario when you have now hired someone who has kind of like decided they're going to just go and do whatever they want to do? What happens then?
Senator, I would
Go ahead.
mention that I would hope that one single decision, unless it really rose to some horrible level, would be grounds for termination. And what should happen, and I think what does happen on a regular basis, is that if a health officer makes a decision that just doesn't sit well, that there's a discussion between the county government, that might be the county administrator, it might be elected officials, and the health officer as to why the county's seeing something from one perspective, the health officer's made a decision from a different perspective, and then you work toward common ground. If over time there's a pattern of, and I'm not sure how you want to phrase it, but decisions that conflict, then I think you're talking about meeting one of probably incompetency, because these are very broad categories. Nothing is defined here. But I would, again, if there was one instance where a health officer made something that was clearly dangerous to the public health, that in and of itself should be sufficient. And I think what you're driving at is if it's smaller things. And again, this happens on a regular basis, and there's a coordinated effort among health officers to work with county officials to, again, find that common ground.
Yeah, no, so I understand what you're saying. It is, that's part of what I'm talking about, but I'm also talking about, I mean, we do provide some powers to our health officers inside of our counties, and I'm thinking about that. I mean, they do. They can make some, they do have some pretty serious powers that they have.
And I'm just sharing that I didn't see where what you just talked about would I didn't see them in the 5 choices. So that's all. That's just my question, that's all.
Okay, Senator Jennings.
Thank you. So, Dr. Boucher, as a Harford County Senator, I will tell you that we had no idea what was going on with the county council. And I am sorry that you had to go through that, because I and some of my colleagues upstairs, the other senators, were asking what's going on, why, what is the issue? And I will tell you, they kept telling us it's a personnel matter, we can't talk about it. Even sometimes behind closed doors, you'll say, all right, so what was the issue? They still wouldn't tell us. So I don't know the issue. I'm sorry you had to go through it. I did have constituents who did contact me asking me to reinstate you, but as you know, in Harford County, the county council is the de facto health department, and they're the ones who had the jurisdiction. So I thank you for your service as a Harford County resident, but I am very sorry the way you were treated.
Thank you, Senator. I really appreciate that. And it really makes my point that the shroud of secrecy allows them to dodge behind the personnel matter. There was no personnel matter. I wrote to the paper saying, please let me explain, or explain to me, because I would love the daylight on this, the sunlight on this. We don't have it. And they're just dodging. There really was no reason that they should terminate me other than the politics.
Okay, Senator Reedy.
Thank you, Madam Chair. And I wanted to maybe follow up with what Senator Augustine was asking about, because you made some good points. I think my question is, when you talk about, in Senator Augustine's example, some decisions, a series of decisions maybe have been made that seem to be just not right in the judgment of the elected body of the county. And you talked about how if that was happening, the two sides have to come together. And often there is a situation where a health officer makes a ruling and it seems incongruous and they come together and they compromise. But you do have to admit that you're setting that up to be that the health officer is a co-equal branch of government in that case. Is that fair? Am I fairly saying that or no?
I mean, from the perspective of the 5 reasons for termination listed in this bill, and again, they are not defined, they are used elsewhere in the code, and so we know from practice, from the superintendent position, situation for schools, it has not been a hurdle to terminating a superintendent who has acted outside the boundaries of their authority or with incompetence. And I think the acting outside of what is best for public health is acting incompetently. I think we would agree that that's not how a health officer could or should act. And so that would fall within the incompetence. So from an employment law perspective, the 5 reasons set out in this bill are literally other than an at-will, the smallest hurdle that you can have to terminating someone. They're very broad provisions.
Thank you for that answer. I think we're not just talking, though, about decisions that go contrary to maybe public health, which is becoming increasingly more subjective, although there certainly are objective truths about it, but there's a lot of subjectivity to public health. Let me explain. Putting aside COVID for a minute, because obviously that's like the hot button here that we're talking about, I think, are some of these regulations and all that. In our county, and I've had a bill in this committee, in our county, there's been, and in a couple of other counties I'm aware of, there's always a struggle with health officers and staff that perhaps they enforce something to the nth degree beyond what the state law says. If they say the state law and regulations are silent on such and such regulation, I'm going to say you have to do it because the state law doesn't say you can't do it because the state law doesn't say you can, versus another health officer that may say, well, the state law is silent on it, so we're going to allow you to do it. And there can be a lot of a critical mass reached where the elected county government, elected by the people of the county, say, we don't believe this is the way we want things to operate. If we pass this bill, I'm not sure where, and so that's when I say about it setting them up as a co-equal branch of government, obviously not, I don't mean that literally, but in that situation, you've set an unelected person with no contract, unlike a superintendent whose contract could run out. That's my concern with the bill, in a big nutshell, because I just said a whole lot.
And I think one of the, benefits that we have of this setup, as awkward as it might be, that there's a state official who's working in a county, funded by the state, et cetera, is that ultimately the secretary is technically the boss of the public health official, and the secretary has at their disposal assistant attorneys general, so that when conflicts arise between potentially a St. Mary's County health officer and a Wacomico County health officer, they can go to the Council for Public Health, who's at the Maryland Department of Health in the OAG's office, and help figure that out. I've actually done that with counties. I work a lot with counties in helping resolve, oh, we thought it should be interpreted this way or applied that way. And so there are opportunities. I think when the first conflict arises between how one entity is enforcing something and the second entity is, maybe that, and that can be dispossessing to a business that's having to abide that. I understand that. But there is already a system in place to resolve that. And it's not that one health officer could continue to move forward. You could easily get an Office of the Attorney General to advise that this is how the regulations should be interpreted, or the secretary can say, this is how the regulations should be interpreted. And in fact, in many of the situations involving COVID, it was the secretary's office that gave guidance to the local health officers as to how to construe and apply executive orders from the governor.
And also, I would beg to differ that, health officers or health departments would be equivalent to a co-equal branch, because ultimately, in the example that you give, the local county council can still pass a local law restricting whatever concern that they have specifically, and that would bind the folks locally there too.
It gets dicey there, though.
But-
I know we can't get into this, we can maybe talk about it. It gets kind of dicey, because sometimes, it's interesting. It's just interesting, I want to be careful that we don't set up a situation where you can only, like I said, you're a health officer for life, until you don't want to be a health officer anymore, as long as you're not incompetent or I think there needs to be some room for elected bodies to have, some discretion. Obviously, I mean, I understand the situation here may be a little different from that, but anyway.
Well,
thank
I
you.
would just contribute that I believe it is incompetent to ask people to bear regulations that they can't bear. If you impose a rate of change in health behavior faster than the population, that's incompetent. This isn't pure science. It's science in a political and value-laden environment. Part of our competence is to know what will fly without backlash. It's incompetent to push people beyond what they can take. So I don't think we have unlimited power to run people's lives for them.
Let me just butt in to say one thing, and then I'm going to call on Senator Hayes. Senator Jennings has left, but he's in the county where this occurred. And I take seriously his take on it, that it was wrong in their case, that things were happening that should not, that many members of the community wrote to him subsequently once they found this out, because it all happened suddenly and privately, to say they wanted the person reinstated. There is a problem. And I think in the legislation that Senator Lamb has before us, we've got fairly good standards as to what you would recognize as causes for dismissal automatically, and what steps ought to be taken to be sure there's proper due process. I don't know, shut up. Senator Hayes.
Thank you, Madam Chair. I guess I just want to get some clarity on what's going on here. So, and this has been, having these bills is very helpful, because it helps me at least learn a lot about like how some of this work. And I just discovered over the last couple of days through different bills that the health officers are actually, appointed or whatever by the health secretary. But in cases like in Baltimore, what I'm most interested in, whenever we elect the new mayor and council or whatever, we hold the mayor, for example, to be like that, he's responsible and accountable for putting together a good team. And so in cases where you have a change of mayors or a new administration, would this bill by right not give him the authority to choose who his cabinet members are and coming in, unless there was some of the things that fit in these categories? It could be a situation where the health officer didn't do anything, but he wanted his right people, right? Or he wanted diversity in his cabinet that hadn't existed in years. Does this put him in a situation where he or she couldn't make that decision?
Well, even in statute right now, it's not a sole decision of the local county jurisdiction. It is a combined decision with the Secretary of Health.
No, I get that.
I think there are multiple stakeholders that have to come together to decide on who the health officer would be. And in, those discussions, they're able to come to consensus on recommending that health officer for that role. I think, when it comes to terminations, I think there do need to be basic safeguards in place so that what we saw in Harford County doesn't occur in other jurisdictions as well. And so I don't think this is intended to, prevent folks from being able to, work with the secretary in finding people to serve in their local capacities. I think it's continuing a discussion that has to occur with all the stakeholders to find the right person to do that.
Right, but to my original question, would this restrict a new mayor or executive for the county for identifying the person that they believe wants to serve on their cabinet? Would this bill restrict that from happening?
Let me butt in. We've got voting tonight. You weren't able to stay here. I think some of what you're asking was answered in the time when you weren't here, though they're
No.
good. Yeah.
Okay, all
Okay.
right, that's fine.
Okay, and we've got more people, we haven't heard everybody on this one yet. Okay, so did we hear from Joanne Cowdewas? Okay, and from DePaul Niebuhr? If those two people would take the table, we want to hear from the rest of these witnesses, and then we've got another bill, and then we've got a vote tonight. All right, you have 2 minutes each. Miss,
Cotterwas?
yeah.
Okay. Thank you all for having me here today, and I think I'm actually going to provide you some perspective on this. My name is Joanne Cotterwas, and I live in Calvert County, Maryland, where our health officer was attempted to be removed. Actually, I believe was removed and then was reinstated because we in the medical community wrote such a overwhelming number of letters and protests and got a petition together in order to reinstate him. I come to you today with a bachelor's in community health education and master's in healthcare administration and an advanced graduate certificate in healthcare leadership. For most of my working life, I've run 2 healthcare practices with over 1,200 active patients in St. Mary's and Calvert counties. Our health departments in both counties got me through the pandemic so I could get my family, staff, and patients through. My health officer provided weekly emails and availability to pick up the phone for support. They oversaw PPE distribution and made it all possible for my staff to be vaccinated in our office. Our health officers orchestrated and coordinated a response to a politically divisive virus and did so while leaning into science, making hard calls that were not always popular. Now, here's my perspective for you. In my 2 counties, the Board of Commissioners are comprised of 5 men of the same political party who are voted into office with at-large voting, who do not have to answer for the reasons behind their decisions. When they moved to fire our health officer, they did so behind closed doors, without consulting the medical community. How do we provide stability, communication, innovation and operations, information systems, and data collection when a person is abruptly removed without cause? Particularly during a pandemic that is a moving target. The answer is you can't. The pandemic has put masks, vaccines, and personal liberties in front and center, but wait. The health officer is not just overseeing and directing the pandemic response. Also within their purview are community health education, women's health, nursing homes, well and septic education, environmental regulations, to name a few. My county's health officer, I'm just going to brag for a second, has created a mobile crisis team charged with accompanying first responders on calls for overdose or mental health crisis. As a result, Calvert County has had the largest drop in overdose deaths in the last 3 years in the entire state of Maryland. This is nothing short of remarkable, as our overdose rates were once higher than the state average and are now 40% fewer. In closing, it is vital that the decision to fire a health officer be made on the performance of the person in all aspects of responsibility, not on a politically charged hot-button topic of the moment behind closed doors by 5 people of the same political party who are voted into office at large. By supporting SB 548, you are providing stability, continuity of care, and guidelines for removal, rather than leaving our public health and safety to the whims of 5 people behind closed doors. Thank you for your time. Please pass SB 548 out of committee with a favorable report.
Okay, thank you. Now we go to DePaul Niebuhr.
Okay. Good afternoon, Madam Chair, Mr. Vice Chair, and members of the committee. My name is DePaul Nibber, representing the Maryland Association of Counties in opposition to Senate Bill 548. I should start by saying that within our membership, there is an overwhelming sense of gratitude towards our health officers. We know that they have been responsible for shepherding us through this incredibly trying time, this pandemic that seems to continue raging on. And with respect to this bill, some very hard conversations were had, and some serious concerns were raised. And so with that in mind, I will run through 2 realistic and likely scenarios.
You only have 2 minutes. Then.
Yep.
Okay.
Well, with respect to political appointees and how these scenarios play out under this bill. So first, as has been mentioned repeatedly, a new administration enters office and tries to install trusted members of its cabinet. As has been alluded to, our health officers are political actors, and trust is critical. And so we would want to ensure that these folks are a good fit for the administrations that they would be joining. And we would never expect a presidential administration to have holdovers. And so we shouldn't expect the same to happen on the local or on the state level. The second scenario concerns the availability of a potentially better suited option for the local health officer position. So in neither one of these scenarios are they actually fitting within the 5 criterion included in this bill, the for-cause justifications. But assuming they do, for incompetence or insubordination, written justification with evidence would be required. And that could only serve to either embarrass the current appointee, or if said notice makes it to the public, embarrass a new administration before it even has a chance to govern. Altogether, this bill hinders counties' abilities to pursue candidates that our administrations feel are the best fit for their constituencies, and also hinder new administrations and their voters' ability to affect policy. For these reasons, we urge an unfavorable report for SB 548. Thank you.
Okay, thank you very much. Okay, all right, that ends the testimony on that bill. Thank you. Okay, we're going next to Senate Bill 565, Senator Lamb, and you have a panel, Stephen Sakamoto Wingo, Shelley Martin, and Brian Frazee. Senator, you have as much time as you need to lay out the parameters of your bill, and each witness will have 2 minutes each.
Thank you, Madam Chair, members of the committee. For the record, Clarence Lamb, Senator in District 12. This bill is an extension in some ways of a bill that I came to this body just about 2 years ago, right as the pandemic was starting. And I think if you recall back to March of 2020, it was certainly a very anxiety-filled time. And we, as a body, passed legislation that was the COVID-19 emergency legislation back in March of 2020 that included provisions to prohibit price gouging, because we recognized, and among other things it did that, as well as making sure that our residents had access to free tests and other protections as the pandemic was just starting in March of 2020. And so this bill came about as a result of those provisions expiring. The provisions to prohibit price gouging had expired earlier, and that's what was the provenance of this bill. So at the beginning of the crisis, the governor was able to implement an emergency order that prohibited price gouging of essential goods, foods, and services, as well as medical supplies and fuel, because of the legislation that we passed back in March of 2020. There are 31 other states in the District of Columbia that actually have laws against price gouging during emergency situations. Prior to what we passed in March of 2020, there were no prohibitions for price gouging here in Maryland. Current Maryland law does not protect consumers from price gouging during a state of emergency. The pandemic-related emergency authority prohibiting price gouging has expired, based on the law that we passed earlier, thus leaving consumers vulnerable to price gouging in future emergencies. During an emergency, consumers need consistent and affordable access to essential goods and services like groceries, healthcare staffing services, and medical supplies. Under the current law, the Consumer Protection Division of the Office of the Attorney General cannot address complaints about price gouging from Maryland residents during a state of emergency, which is why I've introduced this bill. SB 565 prohibits all businesses, including manufacturers and sellers, from increasing the price of essential goods and services by more than 10% from the price that was charged before the declaration of a state of emergency, unless they can prove that additional costs are being incurred during an emergency itself. This bill not only protects consumers, but also protects Maryland's businesses, who are oftentimes also the victims of price gouging itself. The bill makes the temporary price gouging law that was enacted during the pandemic by this General Assembly against price gouging a permanent law, effective during a state of emergency, as declared by the governor. SB 565 also requires that the Secretary of State establish an electronic notification system where people could register to be informed that a state of emergency has been declared and that the provisions of this bill are in effect. We also have a sponsor amendment, which I believe is included in your packet, which was included at the request of the Deputy Secretary of State pertaining to this requirement, which simply modifies the language to indicate that this requirement does not have to be done through regulations. I would request a favorable report on Senate Bill 565 because I believe that we need to ensure that Maryland residents are permanently protected from price gouging of essential goods and services when a state of emergency is declared. As I mentioned, we passed this provision earlier, and given the recent emergency and with the expiration of those provisions, I believe that we have an opportunity now to be able to act because future emergencies will continue to occur. And the Consumer Protection Division of the Office of the Attorney General needs to be able to have the tools to be able to address price gouging complaints in an emergency situation, which unfortunately is inevitable. I do want to address some of the misleading statements that have already come forward in a prior bill hearing about this, which seems to suggest that there was a cap on reasonable or even significant price increases in certain services during an emergency. That's not entirely true. There is flexibility in this proposed legislation that permits businesses to increase prices by more than 10% on essential goods and services if they can verify that they are incurring additional costs during the state of emergency. So if it costs more than 10% because of actual costs that they're incurring, they can raise the price beyond the 10% limit that's in this bill. The bill helps Maryland join 32 other jurisdictions, including many of Maryland's neighbors, that have clear consumer protections against price gouging during a state of emergency. I would like to thank my sponsor panelists for being here and also ask that thank the committee for consideration and urge a favorable report.
Thank you. Senator Hershey?
Thank you very much, Madam Chair. Senator, just to follow up on the last comment you were making, what is the process to seek this 10%, variance to increase prices?
I think the process would work through the Consumer Protection Division, where if they are contacted by the Consumer Protection Division for deviance beyond 10%, that as long as they have the records and documentation to prove that the actual costs of these goods and services is now extended beyond that 10%, they can provide that justification to the Office of the Attorney General for that instance.
So prices are fluctuating all the time based on certainly the pandemic, worldwide supply chain issues. So a supplier would have to go and make a formal request of the Consumer Protection Division before they were able to do this, or how would that end up working?
No, I don't think so.
Or are you just saying they just don't get penalized?
Right, they wouldn't get penalized. There's no I think, and the Office of the Attorney General can speak to this, but I don't think there's proactivity to trying to go out and find businesses that are doing this. I think a lot of this is going to be reporting to the Consumer Protection Division, just like if you're driving down the street, hurricane just came through and some gas stations charging $15 a gallon, right? Somebody would be unhappy, one of our constituents would be unhappy, they would call the Consumer Protection Division of the Office of the Attorney General to report that, and that could then be further investigated. It's not as though the Attorney General's office would have the ability to go proactively to find these businesses.
Okay, I'll wait to hear more testimony, but thank you very much.
Sure.
Okay, any other questions? All right, we'll go to your panel then. Why don't we start with you, Mr. Sakamoto Wango?
Thank you, Madam Chair, members of the committee. Steve Sakamoto Wengel on behalf of the Consumer Protection Division, the Attorney General's Office, here in support of Senate Bill 565. I want to thank Senators Lamb and Beidel for sponsoring this bill. As was mentioned, at least 31 states plus the District of Columbia, including all of our neighboring states, have laws against price gouging. Maryland does not at the moment. As Senator Lamb mentioned, we did have one temporarily during the pandemic. That law is now expired. So now if we get complaints about price gouging from your constituents, from Maryland consumers, we don't have the authority to take action based on that. When the law was in effect, a lot of the parade of horribles that the opponents of this legislation had complained about in the past did not occur. The process worked well. We did get hundreds of complaints while the law was in effect. We did have a process for contacting the businesses when we got those complaints to try to address it informally without having to take enforcement action. And in response to Senator Hershey's question, yeah, well, it's not going to be in advance. I want to raise my prices. Do I get your okay? It's if we get a complaint saying, your business is price gouging, we would then contact your business and you'd have an opportunity to present us with documentation saying, yeah, the reason I raised my prices by this amount of more than 10% is because my cost went up. And it's like, okay, we accept that. So that's, the process that would be followed here under this bill as well. And during a state of emergency, we're all in this together. We need to try to help each other. And if somebody's going to take advantage of that by taking advantage of an emergency situation to unconscionably raise their prices, there should be consequences and consumers should be protected against that. Also here, concerns by the nurses that, they won't be able to be paid what they're worth because of the limits on price gouging. We disagree and think that the nurses deserve to be paid well, and that's already taken account into the statute. If a health staffing service that provides nurses to hospitals did increase their prices for those nurses by more than 10%, we believe that the costs of paying the nurses would not be a factor. That would be considered a cost increase, and they would not be in violation of the statute unless the health staffing service itself was raising its prices by more than 10%. So we don't think that the amendment that the nurses are seeking is necessary. We think their situation is already covered by the statute. So anyway, we really think that it's time for Maryland to join 31 other states in the District of Columbia in protecting our constituents against price gouging. Thank you.
Thank you. All right, we'll go.
Please.
Senator Hershey.
Yeah, thank you, Madam Chair. Yeah, so just to follow up what we were talking about, because in your example, you said if someone thought there was price gouging, they would contact your office would then contact whoever provides the goods and services, and they say, well, if they can explain that their prices went up, therefore they need to do this, you said that would be fine. But, so I'm not understanding then where this this 10% increase comes into play. You're saying that they, regardless of what their costs of goods and services are, or what it took to obtain those goods, even if that was more than 10%, they could only ask for 10% more?
I mean, you can't just arbitrarily raise your prices by more than 10% while a state of emergency is in effect. If you do raise your prices by more than 10%, you'd have to show that it's due to one of the factors in the bill, which would include that your costs went up by more than 10%, or that, if you're in a business where you raise your prices in anticipation of, what the market's going to be. So we've heard that, with gas stations, they're basing their prices on what they know the next delivery is going to be, not on what the last delivery is going to be. So, if you're raising your prices because of that, once again, that would be another defense to why your prices went up by more than 10%. So, but you can't just say, okay, I'm just going to raise my prices because I can. But you have to show that there were factors, in the marketplace that led to those price increases.
Okay. There are also some concerns that this bill is very specific to the essential goods and services listed here. And again, using the executive order from 2020. How did this list come up? And is this list all encompassing of whatever emergency executive order could take place, or why did we decide to pick this list?
These are culled from other price gouging statutes that are in effect across the country, as well as, items that we believe might come into play in a state of emergency that, Maryland consumers would need to have access to. And that if somebody was artificially jacking up their prices, would impact their ability to do what they need to do to get through a state of emergency.
And most of the things that have been listed here were actually in the bill that we passed back in March of 2020.
Right.
So, a lot of that was drawn from that piece of legislation that was passed into statute, but then the statute expired because it was an emergency COVID bill.
Okay, and Madam Chair, one final question. Again, nobody wants to see price gouging. I'm certainly not advocating for that. I'm just trying to understand the bill. But Steve, you mentioned that you received hundreds of calls. What did your investigations end up finding out? Were there businesses that were price gouging that you were able to clearly identify? And if so, were they in specific categories as listed in the bill here?
There were, in fact, some, but I would like to defer to my colleague, Shelley Martin, who actually, worked on those cases when they came to the office.
Okay.
So she would have more detailed information about that.
Well, after you provide your testimony, maybe you can just answer that for me as well, too. Okay, thank you very much.
Okay.
Thank you both.
Okay, in that case, would you like to go next?
Sure. Thank you, Madam Chairman, or Madam Chairperson, and members of the committee. I'm Shelley
Pull
Martin from
that
the.
mic a little closer to you. They're moving. The whole thing's movable. Just pull the base over. Yes.
My name is Shelley Martin. I'm in the Consumer Protection Division of the Attorney General's Office, and I did coordinate and handle many of these price gouging cases. What we found at the beginning of the pandemic was that the cost of certain things immediately went up. And there was no actual reason for that increase in terms of it didn't cost any more to make these things or to get these things into your local stores. This was simply a result of, opportunistic people in the supply chain realizing, especially with some of the panic buying happening early on, that there was an opportunity to increase their profits. And they did so in a way that hurt consumers in the pocketbook when they're trying to buy the essential goods and services that their family needed. We did see certain patterns, eggs and milk and chicken products. We saw the cost of eggs actually tripled at the wholesale level right after the beginning of the pandemic. We also saw price gouging in masks, gloves, and cleaning supplies. And these were things that, again, there was a surge of buying that had not happened before, and a shortage of supplies to get some of these things into stores in a timely manner. We did investigate most of these cases. The response from our office was to first contact the business to try to get information from them about what they charged prior to the emergency and after, and any supply cost increases that they may have incurred. What we found was that, for the most part, by the time the product reached your local supermarket, the price gouging had already occurred. It wasn't the local grocery chains that were doing the price gouging. They themselves were paying significantly inflated prices for these goods. The emergency legislation applied specifically to retailers, so it did not give us the authority to go further back to those distributors or wholesalers or manufacturers and inquire as to why they had raised their prices so much. But that is something that is solved in the current bill, which would give us that authority to trace back further through the supply chain to find where that price gouging is actually happening.
Okay, that's very helpful. Okay. All right, you want to go on, Brian?
Good afternoon, Madam Chair, members of the committee. Brian Frazee here on behalf of the Maryland Hospital Association in support of Senate Bill 565. I do want to take the opportunity to thank Senator Lamb and the Office of the Attorney General for bringing this bill forward, especially their inclusion of the health staffing services, because the healthcare field, the use of these services has been critically important as we deal with the COVID pandemic and the historic workforce challenges that I know you all are well aware of. In normal times, agency rates are modestly higher than the hourly cost for hospital staff. But now what we're seeing is the typical hourly rate is about 2.5 times higher, and in some cases 3 to 4 times higher. And I want to be very clear that our concern is with the agencies and not the personnel that they represent. We are grateful for all of the nurses and all of the healthcare providers that have been on the front lines of this pandemic for almost 2 years now. And so I just want to make sure we're clear that our concern is with the agencies, and there's very little transparency as it relates to the rates that they charge versus the rates that they actually pay the people that they employ. So with that, I'm happy to take any questions, and we urge a favorable report.
Okay, thank you. All right, we'll go next to Franz Schneiderman, Michael Johansson, Scott Tippin.
Thank you, Chair Kelly, members of the committee. My name is Franz Schneiderman. I'm a consumer advocate and executive director of Consumer Auto Maryland. Works for fairness and safety for drivers, but I really am a consumer advocate, and as a consumer advocate, I strongly feel that this is an important protection that consumers need to prevent really predatory and exploitive pricing in emergency situations. I think we saw that the emergency order prohibiting price gouging was an important tool to protect consumers during the pandemic, but sadly that order has lapsed. But it's not just a pandemic problem. I can remember this problem arising after other emergencies. I remember Superstorm Sandy in 2012. There was a lot of concern about price gouging in the wake of that. Even after Hurricane Katrina in 2005, when there was a tremendous spike in gas prices. This is a regularly occurring problem that will come up again, and consumers need some kind of protection against it. I feel like this is a fairly narrowly and pragmatically tailored bill because it applies, really only to certain essential services that people really need. And it's important that those be protected when people are most vulnerable. And because it does allow, in cases where, cost spikes and shortages caused by the emergency itself require larger price hikes, it does allow for that to happen. More than 30 states have protections like this for their consumers. I really think Maryland consumers need the same kind of protections, so I'd ask you to give the bill a favorable report. Thank you.
Thank you. All right, Mike.
Thank you, Madam Chair. I'm Mike Johansson on behalf of Enterprise Holdings. They operate under Enterprise Rental Car, Alamo, and National Rental Car brands. We actually support the legislation with some amendments that we can submit. We do comply in the 30 states where rental cars are subject to the orders. This bill on its face actually doesn't even say that it covers rental cars directly, but that's actually one of the concerns, not that we want to be included directly, but we want to be really clear if an order comes out that it's very clear whether you're covered or not. This bill gives the governor or the administration to add any good or service designated as essential. And in some states, when they say transportation services, for example, if something like that comes out, you don't know if it actually applies to your business. If it applies, for example, to rental car services, does it really only apply to the trucks that may be needed for repair? Or does it apply to, for example, all individual rental cars? So a company like ours is trying to manage these things across many states with many different interpretations. It's really essential that whatever notice is provided and whatever rules are applied are really clear. Enterprise would prefer not to have any customers call the Attorney General's office and complain about a price increase. So we strive to comply and are actually very conservative in doing so. In some cases, I think Senator Hershey, you're right, it'd be helpful to a business who's trying to comply to be able to communicate with the Attorney General's office and say, this is how we're pricing this based on our prior pricing. Is there any reason you would be concerned with the way we're handling this? And it doesn't have to be a legal opinion, but a little bit of a place to go and answer those questions during an emergency would be helpful. Virginia, for example, has also, instead of just the price from the last 60 days or 70 days, they say you can look at your prices from a seasonal basis. Rental car business, our prices are actually higher in the summer. So if we're in emergency in the winter, and then it extends closer to the summer period, we want to be able to charge our summer prices, not the prices that we charged in the winter. So I will send some language to the sponsors on some Virginia tweaks. So it's, you all can decide the policy of whether or not to pass it. But if you do, there's a lot of work in the regulations that would need to go into place to make sure people can comply with it easily.
Okay.
Thank you very much.
So whatever you suggest in terms of the categories that might need regulatory look backs, suggest what some of those key areas would be for us.
I certainly will. Thank you, Madam Chair.
All right. And who do we hear next?
It's
All
Scott.
right, Scott.
Yep. Thank you, Madam Chair, members of the committee. My name is Scott Tiffin. I'm here on behalf of the Maryland Nurses Association. We are favorable to the overall project of the bill. We're very concerned about price gouging, but our nurses are very concerned about the inclusion of health staffing services. Our nurses have been working tirelessly, endless hours, keeping us safe in our ERs and our ICUs, and in my personal opinion, are grossly underpaid. And they're very sensitive to anything that could put downward pressure on the salaries. And I understand there's language in here that the Attorney General thinks covers this, but I can get to that in a second. A couple points I wanted to point out is that in looking at our neighboring states, they don't, besides one, they don't appear to explicitly include health staffing services. And so our concern is that if we're including it here, we may be putting an economic pressure on these nurses to move to some of these other states that don't do it in the same way. These laws get very complex. There might be parts of this I'm not fully understanding. I also wanted to flag a fairly large difference between this bill and the bill passed in 2020. The legislation passed in 2020 gave some examples of things that could be covered by the price gouging statute. But ultimately, the governor had to say, these goods and these services are related to the emergency and therefore are subject to the price gouging rules that were in the bill. The way this bill works is it says all the enumerated goods and services are automatically covered by the price gouging statute as soon as there's a state of emergency. We think that could be relevant, for example, when Governor Hogan issued a fairly extended opioid crisis state of the emergency, which was totally warranted. But during that entire time period, all the covered goods and services in this bill would have been subject to the pricing rules that are in the law, even if they maybe weren't relevant to that actual emergency. So we just think that maybe could be worked out slightly. And then the last thing is, I think we would like the removal of the health staffing services as an enumerated one and leave it to the governor as a thing to add on if he thought it was necessary. But in our testimony, we did provide an amendment that we think very clearly says the salaries for nurses are not subject to the analysis on whether there's price gouging. The AG's office that you heard, they do want the salaries of nurses to be protected. Our concern is about the language that's currently there and whether it's clear enough on how the salary increases work in the price gouging analysis. Our amendment very clearly protects the salary, carves out the salary, and just says, hey, if the staffing agency is charging an insane premium that's not even going to the nurse, that can be price gouging. But the salary of the nurse is protected in that analysis. So that's in my written testimony. Happy to chat about it with anyone afterwards. Also happy to answer any questions.
I'm not looking, I don't have time to read the bill over again right now, but I thought what was there about nurses, nursing services was dealing with people getting a home health service, such as I pay for my husband is now disabled, and so that I have home health people, and it has been going up and up and up and up. However, considering it's related probably to the pandemic, they have lost a lot of staff. They've had people who tested positive who couldn't work. And so others were having to do double duty and so on. So we'll take a look again, but you don't want us to be so prescriptive in the bill that you can't deal with real price gouging when you see it.
We totally agree, and I think the term that's used in the bill's health staffing services, our interpretation is that it would apply to any staffing service provided by any healthcare provider, not just home health, but that could be a misunderstanding. And then the other thing I would say is that the pricing for nursing is going up. Pricing for a lot of healthcare services is going up. Some of that might be bad actors, but I think a lot of that is about shortages and not enough folks being able to track into that field. So
that's why if it were pandemic related, legitimately so, because of supply chain shortages and people dropping out of the market in a field and so on.
For sure.
I thought that part was good to have in the bill as some guardrails. Senator Biden.
Thank you. Scott, I just want to assure you, I worked on the bill with Senator Lamb and with the hospitals, and absolutely, we want to protect the nurses' salaries.
For sure.
So, we'll look at your amendment, but the plan was to protect the nurses' salaries and keep the agencies from gouging.
I totally appreciate that, and I think that was kind of our understanding and our expectation of how you guys are thinking through this. Thank you.
If no further questions, then we're going to the rest of the witnesses. Thank you. Ellen Valentino, Kirk McCauley, and Sarah Price. These are all unfavorables.
Thank you, and good afternoon. My name is Ellen Valentino. I'm representing the Mid-Atlantic Petroleum Distributors Association in opposition to the legislation. But I want to start off by saying I think some of the supporters with amendments brought up the issues that I were going to bring up that is very concerning with the bill. We do think that during a time of emergency that the governor, the executive of the state, should have the authority to identify the emergency, identify the specific goods that are considered essential during that emergency, and then be able to execute appropriately. He did that during this past emergency. We knew you had a bill in place as well that mirrored his executive order, but it's very important because these type of emergencies, we saw the pandemic. We don't know what the next emergency looks like. It could be a cyber emergency. It could be a number of emergencies that we can't expect. Another provision of the bill that does concern us is this sort of swing of you can't charge more than 10% 60 days prior. Well, I can tell you in our market, things swing internationally very quickly. So I do think that's restrictive. I've looked at that. I wanted to be more constructive surprisingly, I know sometimes it doesn't appear that way, more constructive coming forward. But the governor and the executive, in consultation maybe with the General Assembly, they have this authority. They can measure the emergency, they can identify the goods, and they can hold accountable people who may be gouging. So we are in opposition to the bill.
So you
Thank you.
think that the governor and the General Assembly, even if we aren't in session, have the time to keep meeting to do this kind of thing rather than the AG's office, the department, the Division of Consumer?
The way it works now, the governor does issue the emergency. He does identify by, and the
I
Attorney
mean in
General
terms of
is
what's
the
price
enforcer. Right,
gouging.
right. Yes, that's the way it works now. The issue is with this legislation, I suspect that they're trying to put something in statute that should be, I think, determined on an individual basis based on the emergency. What's essential during that emergency? What's the price gouging components during that specific emergency?
Okay, we'll take another look at it. I
Thank
thought
you.
there were some variations in the bill based on
Thank you.
if you were in a pandemic or some other kind of an emergency and if up and down the supply chain, there was a problem. Okay. All right, who's going next?
Good afternoon, Madam Chair and honorable members of the committee. My name is Sarah Price, here on behalf of the Maryland Retailers Association. I want to start by saying that none of us are here to defend price gouging. We appreciate where the bill is coming from, and we do agree that bad actors need to be addressed. We just have some issues with the bill as drafted, and those have largely been laid out in our written testimony. I want to emphasize that our opposition is coming from the lack of regulatory detail that is available at this time. Based on the way that the bill is drafted, our members have come to us and asked, what is the process going to look like? Will the Attorney General, will they conduct inspections? Is there going to be a reporting process? What happens if there are false reports? How will all of this impact day-to-day operations for businesses? And frankly, even after hearing the testimony from the Office of the Attorney General, I'm still not able to answer all of these questions. The last 2 years have shown us that many outside factors can impact pricing at the retail level, and this has been acknowledged today, and we appreciate that. But the proposal, and we appreciate that the proposal does allow businesses a chance to provide basically evidence of why they have increased their prices. But the lack of information about what that process will look like is still a problem for us because we just cannot determine what the impact will be on businesses or what the burden of proof will really look like. Again, the Office of the Attorney General has mentioned the informal process that they utilized during the pandemic, but we really need to know what this is going to look like moving forward. And, if you're putting this into statute, I can't imagine that it's going to remain such an informal process. We need the details. Finally, we have yes?
Oh, no, I thought you were finished. Go ahead.
Sorry. I just want to note we have concerns about the right of private action that are included in the bill. Again, we want bad actors to be addressed. We just think that this should be handled fully by the Office of the Attorney General when infractions are found to be valid. So with that, we would urge unfavorable. Thank
Okay,
you.
I will ask all three of you at some point to let us know if you were willing to sit on a work group, maybe with the sponsors. I mean, because none of us want the price gouging, but there are a lot of reasons for it and some beyond the control of anybody in the state of Maryland. And I'm just wondering if you would you stick your hand up? Okay, thank you, that's helpful. All right, let's go ahead and hear from.
Chair Kelly, members of the Finance Committee, my name is Kirk McCauley, and I represent WMDA service stations, convenience stores, and repair facilities in Maryland. I won't repeat a lot of what was already said. Most of it was already covered, and I agree with it all on this panel. But SB 565 has a preset of rules, a preset of things that would be banned, you couldn't do under a price gouging law. And not all price gouging laws would be the same, but this treats them all the same. I think it was mentioned before, under the opioid emergency order in 2017, March 1st, 2017. None of these would have been, well, none of them should have been in effect, but under this law, they would be in effect. So you'd have all them regulations in effect for no reason at all. You'd have retailers worry when things like this happen, especially small retailers. They got to go back and research prices from 3 and 4 months back and look at what they can do and price increases, and did I have a sale price back in? Just different things that they got to worry about would be no sense in worrying about, because they shouldn't be in a bill that doesn't need them. So the governor should have the authority and some leeway to be able to treat each incident, each emergency for what it is and for what it needs. And this just treats everything the same.
Okay, I'd ask you the same question. If there were a work group on this to deal with these variables that you have pointed out need to be considered,
I
would
would
you be willing to work on?
be glad to answer any
Because
questions
none
on
of
it.
them, nobody here wants price gouging.
No, nobody wants it, and especially our guys don't want it, because our prices are on a sign up on the street out there.
Sure. And then we know a lot of things.
Right.
From the wholesalers and.
Yeah.
And up and down the supply chain, there's a problem, so there's nothing the retailer can do but to sell.
No, there isn't.
Yeah, but if we could, okay, so I'm not on this bill, but you probably will be contacted since you've indicated that you'd be willing to help. And if you've got other ideas that we haven't even mentioned today, I'm sure the sponsor would be glad to know.
Okay, thank you.
Okay,
Thank you.
thank you. Okay. Oh, what is that? Senator Lamb, you willing to work on a work group with any of these people?
I think Senator Augustine would be. Yeah, I think Senator Augustine's our work group chair guy.
Senator?
I'm just teasing. We're just teasing.
Okay, our bill hearing is over. We'll